A very good morning. With the permission of Learned Director, Sikkim Judicial Academy, I'd like to begin today's training on mental health issues for counselors, person in charge, superintendents of the district child protection units, and child care institutions. To conduct this first session, we have Dr. Sonam Ongmu Lasopa, Senior Clinical Psychologist, STNM Hospital, Gangtok. Now, I would like to request Learned Director, Sikkim Judicial Academy, to kindly offer the welcome address. Thank you.
Thank you, Geeta. Good morning to everyone present here. It is my pleasure and privilege to have benign presence of Dr. Sonam Ongmu Lasopa, Senior Clinical Psychologist, STNM Hospital, Superintendent, Gangtok, as a resource person of today's program, who, despite of having a very paramount assignment of STNM Hospital on the board, has been kind enough to accept our invitation and present here to grace these important sessions of today's program. I, on behalf of Sikkim Judicial Academy, would like to welcome you, madam. And at the same time, it is my privilege to extend cordial and appreciate welcome to all learned counsellors, person in charge, superintendents of district child protection units and child care protection units of all districts and subdivisions of the state. Who, keeping aside of all personal comfort and convenience, come here and participated in this important sessions of today's program. I welcome you once again all. Now, without further delay, to begin the sessions of today's program, I would like to request the learned resource person to kindly guide all learning participants on the first session of today's program, and by saying so, I would like to hand over this platform to learned resource person. Thank you so much.
Thank you so much, Director Sir. A very good morning to all our participants today. So I'll use a mix of both English and Nepali, okay? Because I know the group is also very multifaceted. I've been interacting with all of you since quite a number of years. So it's nice to see some familiar faces and nice to also see others who I have not met before. So before I start the presentation, I would like to say that since you all are a multifaceted group with various backgrounds, but we all come together because we are invested in the mental health and physical health of the children in your various institutes at various capacities. So for some it might be a refresher kind of a training for you all, because I know that Sikkim Judicial Academy has been organizing various programs, especially in relation to child and mental health for the last couple of years. Right? Having said that, the topic that has been assigned to me is also quite vast. So I had to kind of, make the program in such a way so that it is simple, yet at the same time, it covers some of the important points. Your topic nahi thulo cha, we can actually spend a couple of days on each of the topics only. So with that, I will share my screen. So please let me know if you all can see the screen in a bit. Can someone indicate to me whether you can see the screen?
It's not visible till now.
Sorry?
Not visible now.
Not visible? So I'll just try again. Okay. Can you see it now?
Yes, ma'am. It's coming.
Okay. So, the program schedule ma alikiti alagai cha. So, what I thought is first we need to understand a little bit about child development and some of the issues, mental health issues, which children might be facing, which are particularly related to the developmental stage. Okay. And अर्को चाहिँ as counselors or as people who are working in the CCIs, तपाईहरुले चाहिँ practically चाहिँ के अलिकति गर्नु सक्नुहुन्छ भनेर चाहिँ त्यसमाथि I have tried to focus, because I think in the second session you will deal more with counseling, right? So I wanted to make this a little different from what you will learn in the next session. So basically, what we're going to understand first is a little bit on child development, and then what is trauma and how trauma impacts young children, and how we as caregivers can develop some strategies to work with children with trauma. Okay, so alikiti to backtrack a little bit, abo development bhaneko ta tapai sabaiharule alikiti हैन त्यो वर्ड सुन्दा नै बुझिहाल्नुहुन्छ कि अब development भनेको चाहिँ के हो, एउटा progress भन्छ नि हामीले हैन. So progress can be either some sort of a change, right? And it can be both positive as well as negative, and sometimes the progress can be abrupt हैन. Abrupt भनेको चाहिँ अचानक पनि हुन सक्छ कि एकदमै विस्तारमा पनि हुन सक्छ. Okay, so basically right now what we are concerned is in terms of both physical as well as mental development. So if you look at development को theories नै हेर्नु पर्यो भने भिन्न प्रकारको छ. So main दुईटा खालको views छ यसमा चाहिँ. One is stage theories, that कतिवटा capacity जुन चाहिँ हुन्छ, जस्तो अब intelligence होस् या हाम्रो personality या स्वभाव होस्, त्यसलाई चाहिँ it is seen to develop in stages हैन. एकैचोटी develop हुँदैन. नानीहरुको स्वभाव अलिक सानोमा भिन्दै हुन्छ, तर ठुलो हुँदै गएपछि अलिअलि भिन्दै हुँदै जान्छ. तर if you look at continuous खालके development, अब if you look at sight हैन, हेर्नुमा मात्रै पनि नानीहरुको जन्मिँदाखेरिदेखि र ठुलो हुनुसम्म चाहिँ continuous एउटा development नै हुन्छ. नानीहरुले पहिलाखेरि अब तपाईहरुले जन्मिनु बित्तिकै नानीहरु देख्नु भयो भने उनीहरुको कलर्स देख्ने क्षमता अलिकति सबै कलर्स देखिँदैन कि ठुलो ठुलो चीजहरु मात्रै देखिन्छ हैन. तर त्यो चाहिँ एउटा कन्टिन्युअस डेभलपमेन्ट हुनुले गर्दाखेरि यो भिजुअल यस्तोहरु चाहिँ तपाईहरुको कन्टिन्युअस डेभलपमेन्ट हुन्छ. तर ल्याङ्ग्वेज भनेको हैन, एकैचोटी नानी जन्मिँदाखेरि बोल्दैन नि त, पहिला बुझ्नु पर्यो, त्यहाँदेखि वर्डहरु त उहाँले झन् बुझ्नु पर्यो, त्यहाँदेखि मात्रै बोल्नुको एउटा पहिला पनि बोल्दाखेरि टाटा बाइ बाइ गर्दाखेरि एउटा सिलेबल सँगले मात्रै बोल्नु सक्छ. त्यहाँदेखि चाहिँ बादमा चाहिँ हामीले स्पष्टसँगले वर्ड्सहरु हामीले युज गर्न सकिन्छ. ओके, सो what you must remember is that things can happen continuously or it can happen in stages हैन. अब फिजिकल डेभलपमेन्ट हेर्नु भयो भने त्यो त कन्टिन्युअस भयो नि त हैन. अब कन्सेप्सनमा नै नानी के हुन्छ, पहिला आमाको बुढीदेखि नै त डेभलप हुन्छ नि, हामीले त बादमा मात्रै देखिन्छ. तर त्यो चाहिँ एउटा कन्टिन्युअसली एउटा डेभलप हुन्छ. अब जसरी अघि मैले भनेको जस्तो फिजिकल अगाडि नै डेभलप हुन थालिन्छ, तर साइकोलोजिकल जुन चाहिँ हामी टुडे व्हाट वी आर कन्सर्न्ड अबाउट, दैट क्यान ह्यापन एट भेरियस स्टेजेस हैन. जसरी अब मैले भने visual system is not fully functional at birth, तर language system develops much later. Okay, तर अब prenatal भन्ने चीज चाहिँ एकदमै इम्पोर्टेन्ट हो. prenatal भनेको चाहिँ जुन चाहिँ वातावरण नानी भुँडीबाट निस्किनुको बादमाको हैन, तर नानी भुँडीभित्र हुँदाखेरि नै जब डेभलप हुन थाल्छ त्यति बेला नै आमाको स्याहार सुसार हामी किन गर्छ हैन. हस्पिटलमा गरी प्रेग्नेन्ट वुमेनहरुलाई किन बोलाउँछ? बिकज नाउ that is very important, because many things can influence the child's intellectual functioning because what has happened when the mother was pregnant. So actually हामीले चाहिँ intellectual development भन्नु बित्तिकै we should also backtrack a little bit and see कि पहिला के भएको थियो, and can we prevent it, because one of the most preventable forms of mental retardation happens before the child is born. So what can affect एउटा त आमाको न्युट्रिसन हैन, आमाले राम्रो खायो खाएन, भिटामिन्सहरु राम्रो खायो खाएन, आमाहरु एङ्ग्सियस भयो भने एङ्जाइटीको प्रब्लमहरु भयो भने पनि नानीहरुको टेम्परामेन्ट भन्छ नि, स्वभाव, त्यसमा पनि असर पर्न सक्छ. र मदरको जनरल हेल्थ, इफ द मदर इज नट हेल्दी we cannot expect a healthy baby in terms of both physical as well as mental. अनि कतिवटा
अब भाइलाई यहाँ बोलाउँदा यहाँनिर फेरि अब यो छैन भन्छ.
हैन भाइलाई नबोलाएर तपाईले म्युट गरिदिनु पर्यो अन्त अरूहरूलाई पनि डिस्टर्ब हुन्छ है सो maternal age is also important especially in terms of either when the mother is too young when her body is not developed or when the mother crosses above 35 year देखि माथि भएपछि तपाईहरुले सुन्नु भएको होला हैन डाउन सिन्ड्रोम भनेर अरु कतिवटा genetic disorders हरु पनि it increases the risk is increased हैन सम्भावना बढ्छ जब आमाको एज पनि बढिँदै जान्छ ओके अन्त अर्को कुरा आयो हाम्रो टेट्राटोजेन्स भन्छ एनी एजेन्ट दैट कजेस अ बर्थ डिफेक्ट हैन कति चोटी कति भाइरस ले पनि हुन सक्छ कति रेडिएसन ले हुन सक्छ कति चोटी धेरै कारणहरुले हुन सक्छ जो चाहिँ टक्सिक हुन सक्छ आमाले युज गरेपछि जसरी कतिवटा दबाईहरु पनि हामीले भन्छ नि प्रेग्नेन्ट वुमेनहरुलाई नखाइदिनुहोस् भनेर ओके so many times disease also affects so if the mother has some sort of serious disease such as like maybe kidney problems or maybe even cancer when the mother is expecting त्यति बेला चाहिँ प्रब्लम हुन सक्छ ओके ओके त अब यो नक्सा नै हेर्नुस् त तपाईहरुले यो फर्स्ट नानी हेर्नुस् त अलिकति डिफर्म्ड देख्नु नै हुन्छ हैन so यो चाहिँ happened in the in the 1900s especially around 1950s 60s 70s को कुरामा चाहिँ a lot of times pregnant women हरुमा चाहिँ एकदमै धेरै nausea हुन्छ नि वकपकी हुँदाखेरि चाहिँ a lot of doctors used to prescribe one drug called as thalidomide हैन अन्त यो thalidomide चाहिँ nausea को लागि दिँदाखेरि चाहिँ अब त्यति बेला त साइड इफेक्ट्स को बारेमा थाहा थिएन तर त्यो खाँदाखेरि चाहिँ नानीहरुको हेर्नुस् त बर्थ डिफेक्ट कस्तो भयो हात खुट्टाहरु हैन अलिकति अलगै भएर त्यस्तो हुँदाखेरि चाल पाउँदाखेरि चाहिँ सो नाउ thalidomide is not prescribed राइट साइड अफ द फिगरमा हेर्नुस् तपाईले अब यो चाहिँ ब्रेन ड्यामेज देख्नुहुन्छ अब फिटल अल्कोहल सिन्ड्रोम भन्ने चाहिँ के हो भन्दा आमा चाहिँ गर्भवती हुँदाखेरि आमाहरुले मदपानको सेवन गरेपछि चाहिँ ब्रेन डेभलपमेन्ट हेर्नुस् त कस्तो हुन्छ हैन ब्रेन नै श्रिंक भएर जान्छ कतिवटा फंक्शन्स नै हुँदैन नानीहरुकोमा र नानीहरु कति चोटी चाहिँ नानीहरुको लाइफ स्प्यान पनि एकदमै कम्ती भएर जान्छ सो दैट इज व्हाई everything is very important when we talk about intellectual functioning so अब intellectual functioning मात्रै हैन तर अब physical त हामीले भनिहाल्यो तर what else is important for us is अब when we talk about development एउटा त जसरी तपाईहरुले बुझ्नु नै भएको होला हैन language or communication is very important social भनेपछि चाहिँ हामीले नानीहरु चाहिँ कसरी एउटा समाजमा बस्न सकोस् आफ्नो एज को हरुसँग कस्तो पाराले बर्ताव गरोस् आफ्नो ठुलोहरुसँग कस्तो पाराले बर्ताव गरोस् भनेर त्यो ज्ञान पनि सिक्नु पर्यो नानीहरुले पर्सनालिटी धेरै प्रकारको हुन्छ हैन कति जना इन्ट्रोभर्ट हुन्छ कति जना एक्सट्रोभर्ट हुन्छ कति जना इरिटेबल हुन्छ all these get affected when there are certain circumstances surrounding the development of the child हैन इमोशनल भनेपछि चाहिँ भावना सबैकोमा हुन्छ कोही के भन्छ खुश मिजाजको हुन्छ हैन कति जना छिटो रिसाउने हुन्छ त्योहरु पनि दुःख पर्दाखेरि where the children can emotionally regulate themselves भन्छ नि अब रिस उठ्ने कुरा या मन दुख्दो कुरा भएपछि चाहिँ नानीहरुले त्यसलाई सम्हाल्नु सक्छ कि सक्दैन त्यो पनि त सिक्ने कुरा हो नि त हैन सो त्यो पनि एउटा डेभलप हुनु पर्यो नि नानीहरुमा र अर्को चाहिँ इम्पोर्टेन्टली के आयो हाम्रोमा एउटा इन्टेलिजेन्स आयो हैन अब इन्टेलिजेन्स भनेको त तपाईले बुझ्नुहुन्छ तर यो कग्निसन भनेको पनि हाम्रो यो इन्टेलिजेन्स चाहिँ हामीले कस्तो पाराले यसको युसेज गर्ने हैन डिसिजन कसरी बनाउने कुन कुरा राइट हो कुन कुरा रङ हो कसरी बुझ्ने भनेर धेरै प्रकारको एबिलिटी क्षमता हुन्छ जुन चाहिँ अब एउटा ज्ञानी मान्छेले युज गर्छ अब त्यो सबै चाहिँ आयो डेभलपमेन्टमा अब यो चाहिँ तपाईहरुले अलिकति एउटा सानो ग्लिम्स मात्रै देखो आई विल नट गो टु मच इन्टु डिटेल सो अलिकति अब जस्ट टु गिभ यु एन एक्जाम्पल अब ल्याङ्ग्वेज नै हेर्नुस् न हैन अब जन्मिनु बित्तिकै नानीहरुले बोल्दैन हैन सो 2 महिना जतिमा चाहिँ नानीहरुले आ उहरु यसो के आमा बाउ देखेपछि या के देखेपछि उ आ गरेर एउटा आवाज सानो सानो मात्रै बनाउँछ त्यहाँदेखि 4 महिना जति पुगेपछि चाहिँ ब्याबल भन्छ नि आम्मामा ओइ बेला के अचानकमा भनेको जस्तै Excuse me, I'll just close the door. So, 4 महिना जतिमा चाहिँ उहाँहरूले मामा बाबाहरू अचानकमा भनेको जस्तो गर्छ र द्याट कन्टिन्युज टु अराउन्ड 8-10 months जति। त्यहाँदेखि 12 महिना 1 वर्ष जति पुगेपछि चाहिँ 1-2 शब्द नानीहरूले बोल्नु थाल्छ। ओके, सो 2 वर्ष जति पुगेपछि त 2-3 वर्डहरू बोल्नु थाल्छ र सेन्टेन्सहरू पनि उहाँहरूले बनाउनु थाल्नुपर्ने। सो नाउ दिस इज वाट इज कल्ड एज समथिङ एज नर्मल डेभलपमेन्ट। अब यसमा चाहिँ ढिलो भयो भने चाहिँ देन वी नो द्याट 2 वर्षसम्म पनि नानीहरूले 2-3 शब्दको सेन्टेन्स बनाउनु सकेन भने चाहिँ वी नो द्याट देयर इज अ प्रब्लम इन द चाइल्ड्स ल्याङ्ग्वेज डेभलपमेन्ट। ओके, नाउ there is a person called, there was a researcher called Piaget. Okay, so यसमा चाहिँ म अलिकति फोकस गर्न चाहन्छु किनभने this must be something new to a lot of you. So Piaget was a researcher. उहाँले चाहिँ के गर्यो भन्दाखेरि नानीहरूको कग्निटिभ डेभलपमेन्ट भने नि, जसरी अब सोच्ने शक्ति, निर्णय लिने शक्ति, बुझ्ने शक्ति, त्यो चाहिँ कसरी डेभलप हुन्छ भनेर चाहिँ उहाँहरूले स्टडी गर्दाखेरि चाहिँ नानीहरू, सानो सानो नानीहरूलाई चाहिँ उहाँले के गर्यो भन्दाखेरि भिन्न भिन्न एजको नानीहरूलाई उहाँले प्रब्लम सल्भ गर्नु दियो र कस्तो पाराले प्रब्लम सल्भ गर्दो रहेछ, उहाँहरूले कसरी लजिकल बुद्धि युज गर्दो रहेछ कि गर्दैन रहेछ भनेर चाहिँ उहाँले स्टडी गर्यो र त्यहाँदेखि चाहिँ he developed what is known as the stages of development, which is mainly to do with cognitive development. Okay, so उहाँले यसो पाउनु भयो कि सेन्सोरी मोटर स्टेज भनेर चाहिँ बर्थदेखि 2 वर्षसम्म द्याट नानीहरूले चाहिँ इन्फर्मेसन कसरी भित्र लिन्छ भन्दाखेरि अब जसरी हामी सबैले नै गर्छ, तर फर्स्ट चाहिँ कसरी गर्छ, देखेर र छुएर जानकारी लिएर त्यसो गरेर चाहिँ बुझ्छ। अनि नानीहरूले देख्छ तर नानीहरूले चाहिँ रियलाइज गर्दैन त्यति साह्रो, किनभने उनीहरूकोमा त्यति ब्रेन डेभलपमेन्टको क्षमता भइसकेको हुँदैन र कतिवटा अब सिम्बलहरूले चाहिँ अब 2 वर्षसम्म चाहिँ अब आमा के हो भनेर उहाँहरूले बुझेको हुँदैन, तर एउटा जो आमाले चाहिँ अब हैन फिड गर्छ, खाना दिन्छ या देखभाल गर्छ भनेर चाहिँ बिस्तारै मात्रै ल्याङ्ग्वेज डेभलप भइसक्यो भने मात्रै उहाँहरूले इन्टर्नलाइज गर्छ। ओके, त्यहाँदेखि कन्सेप्ट आयो हाम्रो अब्जेक्ट पर्मानेन्सको। अब्जेक्ट पर्मानेन्स भनेको चाहिँ के हो, अब एकजनाले आएर तपाईँलाई आज खाना दियो, अब त्यो मान्छे चाहिँ तपाईँको आँखाको अगाडि छ भनेसम्म मात्रै नानीहरूको लागि त्यो छ, त्यो आँखाको अगाडिबाट गएपछि त्यो छैन भनेर चाहिँ नानीहरूलाई थाहा हुन्छ कि छैन भनेर त हामीहरूले चाहिँ बुझ्छ नि होइन, कि त्यो मान्छे चाहिँ छ, एउटा मान्छेले आएर दिएको हाम्रो आँखाको अगाडि छैन तर खासमा त त्यो मान्छे छ नि होइन, त्यो त तपाईँहरूले बुझ्नुहुन्छ। तर नानीहरूलाई चाहिँ यस्तो लाग्छ कि आँखाको अगाडि छैन मिन्स त्यो चिजै छैन। ओके, द्याट अब्जेक्टको चाहिँ इम्पर्मानेन्ट हो, त्यो पर्मानेन्ट चाहिँ छैन भनेर। तर सो वाट आई मिन टु से इज द्याट अब्जेक्ट्स एक्जिस्ट इन्डिपेन्डेन्ट अफ वेदर वी आर सिइङ देम होइन, हामीले देख्नै पर्छ भनेर चाहिँ छैन नि त। तपाईँलाई याद छ कि स्कुल छ या तपाईँको घर छ तर तपाईँको आँखाको अगाडि छैन भने पनि तपाईँको मनमा त छ नि कि त्यो छ भनेर। त्यो क्षमता चाहिँ सानो नानीहरूमा 2 वर्षसम्म चाहिँ यति साह्रो राम्रो डेभलप भइसकेको हुँदैन। त्यसले गर्दाखेरि लुकीचोरी खेल्दाखेरि होइन कि हामीले नानीहरूलाई कुकु हा हा गर्दाखेरि सानो सानो नानीहरूले चाहिँ त्यो बुझ्दैन, तर अलिकति अझै ठुलो हुँदै गएपछि चाहिँ त्यहाँदेखि बुझ्छ कि ए होइन लुकेपछि चाहिँ फेरि आउँछ भनेर चाहिँ छ होइन। सो द्याट्स हाउ थिङ्स डेभलप। सो त्यहाँदेखि सो द्याट इज वाट ह्यापन्स इन चिल्ड्रेन बिट्विन 0 to 2 years। अब 2 to 7 yearsमा चाहिँ के हुन्छ भन्दाखेरि सिम्बोलिक थट चाहिँ डेभलप हुन्छ। सिम्बोलिक थट भनेको के हो भन्नुहोस् त, यसो विचार गर्नुभयो भने कि समथिङ स्ट्यान्ड्स फर समथिङ होइन, आमा भनेको के हो या खाना भनेको के हो भनेर एउटा तपाईँको मनमा त छ नि, त्यो चाहिँ सानो नानीहरूमा डेभलप हुँदैन, 2 देखि 7 सम्म डेभलप हुन्छ। इगोसेन्ट्रिजम भनेको चाहिँ के हो भन्दाखेरि नानीहरूको चाहिँ के हुन्छ, अरूहरूको दुःख अरूहरूको बारेमा उनीहरूलाई त्यति ज्ञान हुँदैन नि त होइन। उनीहरूले चाहिँ पुटिङ यर सेल्फ इन अदर पर्सन्स सुज भन्छ नि, अरूलाई कस्तो अनुभव भइरहेको छ त्यो ज्ञान उनीहरूकोमा हुँदैन। the world revolves around them, right? So they will only know what they can see, what they can feel. So they do not know much about what others feel, what others think. Okay, so त्यो त्यति साह्रो ज्ञान हुँदैन र बिस्तारै बिस्तारै डेभलप हुन्छ यो र एउटा ल्याक अफ कन्सेप्ट भन्छ नि कि ढाट्नु हुँदैन, चोर्नु हुँदैन भनेर हामीले भन्छ नि, हो त्यो चाहिँ अब त्यो कन्सेप्ट हो नि त एउटा, हैन? चोर्नुको मतलब के हो, ढाट्नुको मतलब के हो, हैन? राम्रो गर्नुको मतलब के हो, त्योहरू पनि राम्रो गरेर डेभलप भइसकेको हुँदैन। तर अब यो 7 वर्षदेखि 12 वर्षसम्म चाहिँ देन चिल्ड्रन बिकम मोर अलिकति ज्ञानी, हैन? बुझ्नु सक्छ उनीहरूले र लजिक युज गर्नु सक्छ कि ए यो भने चाहिँ त्यो हुन्छ, हैन? क्लासिफाई गर्नु सक्छ कि ए फ्रुट्सको अब हैन एप्पल भनेको के हो, यो हो भनेपछि यो फ्रुट हो कि हैन, क्याटेगोराइज हामीले गर्नु सक्छ कि सक्दैन, हैन? त्यो क्याटेगोराइजेसनको क्षमता हुन्छ। त्यहाँदेखि अरूहरूको भावना अरूहरूको अनुभव पनि उहाँहरूले बुझ्नु थाल्नु सक्नुहुन्छ। त्यहाँदेखि अब्जेक्ट पर्मनेन्स पनि धेरै राम्रो भइसकेको हुन्छ र झन् अलिक ठुलो भइसके पनि चाहिँ त्यहाँदेखि हामी ठुलो मान्छेहरू जस्तै अलिकति हैन यो भने चाहिँ त्यो रिजनिङ गर्नु सक्छ, त्यो सबै ग्रेजुअली हुन्छ। त्यहाँदेखि ज्ञान चाहिँ बढ्दै जान्छ। सो आई वान्टेड टु फोकस ओन्ली अन cognitive and language development right now, especially for developmental issues. अब यो भन्दै let's move on to some of the problems that children might have because of the developmental stage they are in, हैन? सो एउटा चाहिँ के हुन सक्छ, तपाईले सुनिराको नै हो, पहिला चाहिँ अब मेन्टल रिटार्डेसन को बारेमा भन्छु। त्यो चाहिँ इन्टेलेक्चुअल डेभलपमेन्टल डिसेबिलिटी हो। त्यहाँदेखि अरु चाहिँ व्यावहारिक रूपमा कतिवटा नानीहरुमा मात्रै प्रब्लम हुन्छ, जस्तो कि एटेन्सन डेफिसिट हाइपर एक्टिभिटी डिसअर्डर, एउटा भनिन्छ अपोजिशनल डिफाइन्ड डिसअर्डर र कन्डक्ट डिसअर्डर। अब यो चाहिँ मैले किन फोकस गरेको भन्दाखेरि किनभने तपाईहरुको एउटा जुन चाहिँ सीसीआई मा तपाईहरुले सायद यो टाइप अफ प्रब्लम्सहरु चाहिँ तपाईहरुले ज्यादा देख्नुहुन्छ र डिप्रेसन एंजाइटीहरु पनि हुन्छ नानीहरुमा, तर त्यो त तपाईहरुले अब देख्छ नि, हैन? बुझिसक्नु नै भएको छ होला भनेर चाहिँ मेरो अन्दाजमा छ। So when you look at अब स्पेशली अब स्पेस्टिक सोसाइटी उहाँहरुलाई चाहिँ झन् अब ज्यादा जानकारी हुन्छ यो इन्टेलेक्चुअल डेभलपमेन्टल डिसेबिलिटी को बारेमा। तर फर एभ्रीबडी इट इज टु अन्डरस्ट्यान्ड दैट intellectual disability is some form of neurodevelopmental disability, हैन? That means there is a dysfunction at the neuronal level in the brain which affects global functioning. अब ग्लोबल भनेको चाहिँ सबैतिरमा चाहिँ अलिकति बाधा डाल्ने, हैन? जसरी बोल्नुमा पनि, बुझ्नुमा पनि, कोही बेला हिँड्नुमा पनि, हैन? कतिजना तपाईहरुले देख्नु भएको होला नि सेरेब्रल पल्सी भएको नानीहरुलाई मोटर फंक्सनमा पनि प्रब्लम हुन्छ, बोल्नु पनि सक्दैन, बुझ्नु पनि सक्दैन, हैन? सो ऑल दिस यो इन्टेलेक्चुअल डिसेबिलिटी भएकोहरुको चाहिँ डे टु डे लाइफमा नै प्रब्लम दिन्छ। ओके, सो कतिजनाको चाहिँ सिभियर प्रब्लम चाहिँ हामीले देखिहाल्छ नि त, बुझिहाल्छ कि उले केही पनि बुझ्दैन भन्यो भने त हामीले पनि बुझिहाल्छ। तर कतिवटा चाहिँ माइल्ड फर्ममा पनि हुन्छ जो चाहिँ अब क्लास 8 सम्म पनि पढ्न सक्ला, तर अब फेल हुँदै हुँदै, हैन, एकदम ढिलो प्रकारले बुझ्ने। सो व्हेन यु लुक एट इट ग्लोबली चाहिँ अब 3% अफ द पपुलेसनमा चाहिँ, हैन, नानीहरुमा चाहिँ हामीले यो मन्दबुद्धि भनेर चाहिँ देखिन्छ। अनि इन्डियाको स्ट्याटिस्टिक्स हेर्नु पर्यो भने चाहिँ अराउन्ड 5 in 1000 चिल्ड्रन विल हैव सच अ प्रब्लम। ओके, अब केमा प्रब्लम हुन्छ भन्दा चाहिँ अब सिक्नुमा नै प्रब्लम हुन्छ। ओके, लर्निङमा अब नम्बर्सहरु सिक्नु, टाइम, अल्फाबेट्स, त्यो सबै सिक्नुमा नै प्रब्लम हुन्छ र बुझ्ने शक्ति नै अलिकति कम हुन्छ उहाँको, के चाहिँ राइट हो के चाहिँ रङ हो, कसरी हामीले एउटा रिजनिङ पावर जुन चाहिँ हुन्छ त्यसमा पनि अलिकति कमी हुन्छ र प्रब्लम सल्भिङ, हैन, यो गर्दाखेरि कस्तो पाराले हामीले सल्युसन निकाल्नु। अब तल तादोङ जानु छ भने यता बजारबाट एमजी मार्गबाट नामनाम ओरालो जान्दा पनि हुन्छ, या यता बाट पनि जान्दा हुन्छ, अहिले त उता सिचेबाट जान्दा पनि हुन्छ। तर अब हैन त्यो त हामीले बुझ्छ, तर सायद उहाँहरूले त्यो प्रब्लम सल्भ अब यो बाटो बन्द भयो भने अर्को बाटोबाट कसरी जानु भनेर त्यस्तोहरुमा प्रब्लम सल्भिङमा नै कमी हुन्छ। सो तपाईहरुले हेर्दाखेरि चाहिँ अब यो त तपाईहरुले देखिरहनु नै भएको होला। सो पीपल हैव प्रब्लम इन, चिल्ड्रन हैव प्रब्लम इन एक्वायरिङ न्यू स्किल्स, हैन, व्हिच उनीहरुको डे टु डे लाइफमा युज गर्न सक्छ। जसरी अब लुगा लाउनुमै प्रब्लम हुन सक्छ कतिजनालाई, अनि टेकिङ केयर अफ देयर ओन पर्सनल हाइजिन, learning any kind of language, learning about time, learning about concepts such as पैसा, पैसा चिन्नु सक्छ तर उनीहरूले दोकानमा गएर यति पैसा दियो भने यति पैसा फर्किन्छ भनेर त्यस्तो उनीहरूले गर्न सक्दैन। सोशल रेस्पोन्सिबिलिटी उनीहरूले बुझ्दैन या इन्टरपर्सनल स्किल्स नानीहरूसँग मिलेर अरू नानीहरूसँग मिलेर खेल्नु सक्दैन, त्यस्तोमा प्रब्लम हुन सक्छ। सो एक्टिभिटिज अफ डेली लिभिङमा पनि जसरी उनीहरूले यहाँदेखि त्यहाँ जानु नसक्ला, फोनमा कस्तो पाराले बात मार्नु, आफ्नो सेफ्टी कसरी याद गर्नु, आगो कतिजना नानीहरूले आगो गएर छुनु सक्छ। ओके, सो अल दिस थिङ्स या ठुलो भएर अलिक काम गर्नु नसक्ला। ओके, सो दिस आर सम अफ द थिङ्स द्याट ह्यापन वेन यु आर ह्याभिङ इन्टेलेक्चुअल डेफिसियन्सी। सो अल दिस आर सम साइन्स द्याट यु माइट हेभ अलरेडी सिन। कतिजना नानीहरूले ढिलो बोल्छ या ढिलो हिँड्नु थाल्छ, त्यो त तपाईहरूले बुझ्नुहुन्छ। र टोयलेट ट्रेनिङ, ड्रेसिङ, फिडिङमा नै प्रब्लम हुनसक्छ, बुझ्ने शक्ति कम्ती हुन्छ। र मैले यो गर्यो भने यसको कन्सिक्वेन्स यो हुन्छ भनेर बुझ्नु सक्ने शक्ति कम्ती हुन्छ। र आफैले चाहेको चिजहरू राम्रो एक्सप्रेस गर्नु सक्दैन या बुझ्नु सक्दैन। त्यहाँदेखि कतिजनालाई त हिँड्नुमा या फाइन मोटर स्किल्स भन्छ नि, अब पेन पक्रिनु सक्छ होला, पेन्सिल पक्रिनु सक्छ होला, तर राम्रो गरेर लेख्नु सक्दैन। इमोसनल डिसरेगुलेसन पनि हुनसक्छ जब उहाँहरूले चाहेको चिज पाएन भने एकदमै एक्टिङ अर बिहेभियर गर्नु सक्छ। कतिजना नानीहरूले त टाउको पुरा हिर्काउँछ दिवालमा, कतिजना पुरा चिचाएर कराएर फकाउँदाखेरि पनि नफकिने, त्यस्तो नानीहरू पनि हुन्छ। देन युजुअली when they have intellectual problems, त्यति बेला हुन्छ। So we'll move on to now what is known as attention deficit hyperactivity disorder. अब यो चाहिँ this is again another neurodevelopmental disorder. यसमा चाहिँ the cardinal feature चाहिँ के छ भन्दा नानीहरूले ध्यान दिनु सक्दैन। ओके, सो एटेन्सन उनीहरूले राम्रो कन्सन्ट्रेट गर्नु सक्दैन। ओके, अन्त त्यहाँदेखि के हुन्छ, हामीले यसो हेर्दाखेरि चाहिँ छुकछुके नानी भन्छ नि, अब यसो हेर्दाखेरि धेरै छुकछुक गर्ने, एउटा ठाउँमा बस्नै नसक्ने, एकदमै हाइपर एक्टिभ भएर यताउता गएर सबै चिजहरू भत्ताबुङ्गै पारेको जस्तो लाग्छ। र कतिजनाले चाहिँ इम्पल्सिभ बिहेभियर देखाउँछ, जस्तो कि अब राम्रै बसिरहेको हुन्छ, अचानक गएर कुनै के गरिदिने, जसमा चाहिँ परिणाम चाहिँ अलिकति कोही बेला नेगेटिभ नै हुन्छ। सो विल डिस्कस द्याट इन अ लिटल डिटेल। सो यसमा चाहिँ सायद रिसर्चले बताएको छ कि जेनेटिक कम्पोनेन्ट हुनसक्छ कि अब फ्यामिलीजमा छ भने चाहिँ यो नानीहरूमा यस्तो प्रब्लम हुनसक्छ। सो अ लट अफ टाइम्स के हुन्छ भन्दा चाहिँ अब यो नानी त कस्तो बदमास, यो नानी कस्तो छुकछुके भनेर चाहिँ समटाइम्स एक्चुअली दिस चिल्ड्रेन मे बी ह्याभिङ एटेन्सन डेफिसिट हाइपर एक्टिभिटी प्रब्लम, तर हामीले चाहिँ उनीहरूलाई मिसलेबल गर्छ कि यो त बदमास छ, यो चाहिँ के भन्छ छुकछुके छ, नटी छ भनेर चाहिँ। त्यहाँदेखि कतिजनाले चाहिँ अब कतिजनाले कुद्छ कि फोन दिएर लु बस्छ भनेर त्यसो गरिदिन्छ। सो यसो हेर्दाखेरि चाहिँ वेन वी पनिस देम चाहिँ यो प्रब्लम चाहिँ झन् बेसी हुनसक्छ। ओके, सो अब अलिकति विस्तारमा हेर्नु पर्दाखेरि अब इनएटेन्सन चाहिँ एक्सक्युज मी कहिले देखिन्छ भन्दाखेरि when a child is involved in any task that requires some sort of हेर्नु पर्यो, ध्यान दिने काममा, या ऱ्यापिड रियाक्सन टाइम, अब टिचरले क्वेसन सोध्नु पर्यो भने कसले आन्सर गर्ने भनेपछि चाहिँ हामीले त एउटा रियाक्ट गर्नु पर्यो कि एउटा केही चिज खोज्नु पर्यो। तर एउटा सिस्टमेटाइज्ड वेमा चाहिँ हामीले एउटा रिस्पोन्स दिनु पर्यो कि हामीले ध्यान दिएर सुन्नु पर्यो, कि आँखाले हेर्ने ध्यान दिनु पर्यो कि कानले सुन्ने कि एउटा जवाब दिने कि आँखाले देख्नेमा। त्यसमा नै उहाँहरूको प्रब्लम भएर उनीहरूले ध्यानै दिनु सक्दैन। अब त्यो ध्यानै दिएन भने त्यहाँदेखि उसले त केही जानेन भनेर पनि हामीले मिस रिड गर्न सक्छ। अर्को चाहिँ अब हाइपर एक्टिभिटी भनेको चाहिँ अब एकदमै हातखुट्टा, मोटर भनेको के हो भन्दाखेरि हातखुट्टा चलाउने क्षमता, त्यो चाहिँ एकदमै बेसी क्या। यताउता हिँडेर छुकछुके रेस्टलेस देख्छ, फिजिटी देख्छ कि ज्यादा बोलेर अर्कालाई चलाइरहेको, क्वाइटली स्कुलमा बस्नु नसक्ने। सो वी निड टु सस्पेक्ट द्याट यो नानीमा खासमा त एडिएचडी को प्रब्लम पो छैन कि भनेर चाहिँ हामीले त्यसमा चाहिँ बुझ्नु पर्यो। अनि इम्पल्सिभिटी भनेको चाहिँ एकदम हेस्टी एक्सन लिने, नसोचिकन झटपट केही न केही एउटा एक्सन दिने जसले चाहिँ एउटा नेगेटिभ आउटकम लिने अब बाटोमा राम्रै हिँडिरहेको छ भने झट्टै यसो कुदेर ट्राफिकमा कुद्दै गयो भने हैन प्रब्लम हुन्छ सडनली अब अलिक ठुलो भएपछि चाहिँ सडनली उसलाई स्कुल जानु मन परेन स्कुल जानु छोडिदियो या ठुलो मान्छेहरू हो भने काममा जानु छोडिदियो कि विदाउट थिङ्किङ कि यसको हैन नेगेटिभ कन्सिक्वेन्स हुन्छ कि पोजिटिभ कन्सिक्वेन्स हुन्छ सो वेन दिस थिङ्स अल थ्री थिङ्स आर प्रेजेन्ट त्यति बेला चाहिँ हामीले एडिएचडी छ भनेर चाहिँ हामीले बुझिन्छ अब वान थिङ अबाउट एडिएचडी इज अब यहाँ मैले अलिकति लिस्ट गरिदिएको छु तपाईँले देख्न सक्नुहुन्छ होइन एउटा अब होमवर्क गर्नु छ भने क्लोज एटेन्सन पे गर्नु सक्दैन केयरलेस मिस्टेक गर्छ नानीहरूले हो अब दाँत ब्रस गर्नु लगायो भने या लुगा पट्याउनु लगायो भने पनि एकदमै एटेन्सन पे नगरिकन राम्रो गरेर नगर्नु सक्ने बाहिर केही आवाज आयो भने बरु त्यहाँपट्टि ध्यान छट्टै गइहाल्ने होइन गर्दै गरेको कामलाई छोडेर एक्सटर्नल चिजमा होइन केही चिज लाउड नोइज आयो या केही अर्काले बोलायो भने बरु ध्यान त्यता भट्किहाल्ने सो छिट्टो डिस्ट्र्याक्ट हुन्छ नानीहरू र छिट्टो बिर्सेको जस्तो पनि लाग्छ उहाँहरूलाई र लामो एउटा बसेर सस्टेन्ड एटेन्सन बस्नुपर्ने काममा चाहिँ उनीहरूले गर्नु नसक्ने ओके र अर्गनाइजेसनमा पनि प्रब्लम हुनसक्छ र आफ्नो चिजबिज छिटो क्या त्यो किनभने ध्यानै हुँदैन कहाँ छ छिटो हराउने र हाइपर एक्टिभिटीमा चाहिँ अब डिफ्रेन्ट लेभल्स हुनसक्छ कि होइन हात खुट्टासँग एकदम चलाइ अब बसेर एउटा ठाउँमा बस्नै नसक्ने खेल्दाखेरि त्यो सस्टेन्ड एटेन्सन नगरे यताउता कुदिहाल्ने हो त्यस्तो गर्ने र इम्पल्सिभिटी चाहिँ नानीहरूमा चाहिँ कसरी देख्छ भन्दा अब हामीले क्वेसन बनिसकेकै हुँदैन उनीहरूले के आन्सर दिनु खोज्छ कि इन्टरप्ट गर्छ कि हामीले के एक्टिभिटी गर्दैछौँ भने उनीहरूले त्यसमा इन्टरप्ट गर्नु सक्छ या आफ्नो एउटा वेट गर्ने लाइनमा पर्खिनु पर्ने आफ्नो टर्न वेट गर्नुपर्नेमा उनीहरूले वेट गर्नु सक्दैन अब तपाईहरूले के चाहिँ बुझ्नु पर्यो भन्दाखेरि यो एडिएचडी चाहिँ को लागि चाहिँ हाम्रोमा दबाई हुन्छ सो देयर आर भेरियस मेडिकेसन्स होइन विच आर कल स्टिमुलेन्ट्स जुन दियो भने चाहिँ उनीहरूको यो इनएटेन्सन यो हाइपर एक्टिभिटी चाहिँ कम हुने चान्सेस हुन्छ ओके तर जुन चाहिँ अघि मैले भने जस्तै मन्दबुद्धि इन्टेलेक्चुअल रिटार्डेसन त्यसको लागि चाहिँ हाम्रोमा केही दबाई चाहिँ छैन सो वेन अ पर्सन इज इन्टेलेक्चुअली डिसेबल्ड त्यसमा वी क्यान नट गिभ मेडिसिन्स टु इम्प्रुभ देयर इन्टेलेक्चुअल डिसेबिलिटी बट द्याट डजन्ट मिन दे क्यान नट बी टट एनिथिङ नि होइन उनीहरूलाई ट्रेनिङ दियो उनीहरूको कति न कति एउटा पोटेन्सियल चाहिँ हुन्छ त्यो पोटेन्सियल चाहिँ हामीले एसेस गरेर आइक्यू टेस्टहरू हुन्छ त्यसमा चाहिँ हामीले कति क्षमता छ भनेर चाहिँ उहाँहरूलाई टेस्ट गरेर चाहिँ त्यो क्षमतासम्म चाहिँ हामीले पुर्याउन सक्छ ओके सो अब आयो तपाईँहरूको अलिकति तपाईँहरूले अझै ध्यान दिनुभयो भने चाहिँ एउटा डिसअर्डर छ अपोजिसनल डिफायन्ट डिसअर्डर भनेर यसमा चाहिँ नानीहरू चाहिँ कस्तो हुन्छ भन्दाखेरि तपाईँहरूले यसो हेर्दाखेरि अरे कस्तो अचेरी नानी भन्छ नि हामीले भनेकै मान्दैन र कस्तो होइन कोही बेला त हस्टाइल बिहेभियर देखाउँछ भनेको नै नटेर्ने नडराउने होइन अन्त हामीलाई चाहिँ लाग्छ कि अब कस्तो भनेर ठुलो मान्छे देख्यो भने एउटा अलिकति बोल्ने ढङ्ग पनि छैन भनेर अनि कोही बेला चाहिँ एकदमै रिस्वा खाले नानी छिट्टो रिसाउने जस्तो देखेपछि चाहिँ हामीले चाहिँ यसो बुझ्नु पर्यो कि अरे उसकोमा त ओडिडी पो छैन कि भनेर चाहिँ तपाईँहरूलाई अलिकति एउटा शङ्का एउटा पैदा हुनुपर्ने तर अब सबै अटेरी नानी डजन्ट मिन इट इज अपोजिसनल डिफाइन डिसअर्डर होइन तर के हुनु पर्यो सधैँ नै यो नानी यस्तो छ भने धेरैचोटि सर्कमस्टान्सेसमा सबैसँग नै त्यस्तो छ भने चाहिँ ओडिडी हुनसक्छ अब कोही नानी अलिअलि अटेरी हुनसक्छ तर हामीले उसलाई सम्झाएर बुझाएर गऱ्यो भने उनीहरूको बुझ्ने क्षमता छ भने चाहिँ अब त्यो चाहिँ ओडिडी होइन ओके सो त्यसमा चाहिँ अब यसो हेर्दाखेरि सबैको एउटा डिग्री हुन्छ यो डिग्री चाहिँ अलिकति बेसी छ होइन अब थुप्रो नै त्यस्तो छ र सधैँभरि नै त्यसो गर्दैछ भनेपछि चाहिँ यो चाहिँ ओडिडी हो भनेर चाहिँ हामीले बुझ्नु पर्यो र अब यो ओडिडी छ भने चाहिँ एउटा यिनीहरूको ज्यादा चान्स हुन्छ एउटा अहिले म एकछिनमा भन्छु तपाईँहरूलाई कन्डक्ट डिसअर्डरको बारेमा अब ओडिडी छ भने चाहिँ देयर इज लाइकलीहुड द्याट ठुलो भएपछि उनीहरूलाई कन्डक्ट डिसअर्डर पनि हुनसक्छ ओके सो अब यसको लक्षणहरू चाहिँ के हो भनेर चाहिँ हामी यसो हेरौँ है अब यो जुन चाहिँ मैले 1 2 3 4 5 6 7 8 9 वटा जुन चाहिँ लक्षण मैले त्यहाँ लगाएको छु त्यसमा चाहिँ एटलिस्ट 4 वटा लक्षण चाहिँ धेरै टाइमको लागि छ भने चाहिँ यो नानीमा चाहिँ ओडिडी छ भनेर चाहिँ हामीले बुझिनु पर्यो एउटा चाहिँ के हो मुड रिलेटेड होइन ज्यादातर छिटो कुरामा जे कुरामा पनि उले एकदमै हैन रिसाउने या टेम्पर लुज गर्ने, अरु मान्छेहरु ठुलो होस् सानो होस् सँग एकदमै अनय भइहाल्ने, रिसाइहाल्ने र एकदमै यसो हेर्दाखेरि अफन एङ्ग्री र एकदमै त्यो के रिस बोकेको जस्तो खालके एउटा स्वभाव छ भने चाहिँ हामीले यसो हेर्नु पर्यो। अर्को चाहिँ आर्गुमेन्टेटिभ र डिफायन्ट बिहेभियर भन्छ नि, ठुलो मान्छे होस् या जो मान्छे अब क्लासको क्याप्टन नै होस् हैन, एउटा अथोरिटी फिगरलाई चाहिँ उनीहरूले के माइनै नदिने, उनीहरूले आर्ग्यु गर्ने, उनीहरू नै राइट हो जस्तो पाराले र भनेको चिज गर्नुपर्ने चिजलाई चाहिँ you can see that they are not agreeing to that, हैन, actively defies or refuses to comply with adults requirements, requests or rules। अब जुन चाहिँ हामीले रुल्सलाई पालन गर्नुपर्ने त्यो रुलहरुलाई उनीहरूले यसो हेर्दाखेरि अरे रुल डजन्ट म्याटर टु मी जस्तै खालके एउटा उनीहरूले स्वभाव राखेपछि अनि जानी जानी उनीहरूले अरु नानीहरुलाई या अरु मान्छेहरुलाई के इरिटेट गरेको जस्तो, अनय गरेको जस्तो, यसरी हिकाको जस्तो या ठेलेको जस्तो हैन, र आफ्नो एउटा केही मिस्टेक छ भने पनि उनीहरूले ओनरशिप नलिएर चाहिँ अरूहरुलाई ब्लेम गर्ने या यु नो अफन दे ट्राई टु मिसबिहेभ हैन, भनेपछि नगर भनेपछि पनि हेर्दै हेर्दै उले त उ त्यसो गर्दैछ भनेर हामीले कति नानी त्यस्तो देख्छ नि। सो वी क्यान सी द्याट। अनि अर्को चाहिँ आयो झन् एउटा विन्डिक्टिभनेस भन्छ नि, जसरी अब जानी जानी अर्कामाथि हरेक नराम्रो गर्नु जस्तो, क्या स्पाइटफुल हुनु। अब उ जानी जानी सानो छ तर भए पनि उले अलिकति उसको चिज लगिदिएको जस्तो या ठेलदिएको जस्तो। सो यो चाहिँ के हो, अफन शोज स्पाइटफुल or vindictive behavior at least twice in the past 6 months। So अब यो देख्यो भने चाहिँ now you all have to think कि does this person have some sort of oppositional defiant disorder। अब यसलाई चाहिँ हामीले दबाई दिएर हुँदैन, हामीले चाहिँ उहाँहरूलाई अलिकति ट्रेनिङ दिनु पर्यो, अब हामीले कोसिस गर्नु पर्यो हैन। सो अब now we come to the fourth one which is the one which is called conduct disorder। यो चाहिँ अब अलिकति यसो हेर्दाखेरि अलिकति ठुलो नानीहरुमा पनि हुन सक्छ, स्पेशली अराउन्ड टिनेज इयर्स हैन। अब यो नानीहरुले पनि अलिकति डिस्ट्रप्टिभ र भाइलेन्ट टाइप अफ बिहेभियर देखाउन सक्छ हैन। So what they do is they violate the right of others, goes against any kind of unacceptable जुन चाहिँ norms of behavior हुन्छ त्यसमा चाहिँ अलिकति अगेन्स्ट जान्छ। ओके, एन्ड दिस इज अगेन अलिकति लङ लास्टिङ, अलिकति नर्मल बदमाशी भन्दाखेरि चाहिँ तपाईले देख्नुहुन्छ कि यो नानी त अलिकति हैन के भन्छ अटेरी छ भनेको मान्दैन मात्रै हैन, तर अलिकति बदमाश टाइपको नानी छ भनेर चाहिँ तपाईले बुझ्नुहुन्छ। अन्त यो सबै चाहिँ के हुन्छ भन्दा एभ्रीडे लाइफमा नै उनीहरुको डिस्टर्बेन्स ल्याउँछ, या फ्यामिलीसँग बसेको छ या अरूहरुसँग बसेको छ भने उनीहरुको लाइफमा पनि डिस्टर्बेन्स तपाईले देख्नुहुन्छ र उनीहरुकै सिग्निफिकेन्टली आफ्नो लाइफमा पनि इम्पेयरमेन्ट ल्याउँछ। जसरी साथीभाइहरुसँग मिलेर बस्न सक्दैन, पढाइमा प्रब्लम हुन सक्छ, काम गर्दैछ भने या आफ्नो गर्नुपर्ने चीजहरुमा पनि बाधा आउँछ। अनि उनीहरुले चाहिँ अर्को कुरा चाहिँ के याद गर्नुपर्छ भन्दाखेरि उनीहरुले अरूमाथि केही हैन नराम्रो गर्यो भने पनि दे विल युजुअली नट फिल गिल्ट अबाउट इट के, उनीहरुलाई अरे मैले यो नगर्नुपर्ने काम गरेछु भनेर त्यो अनुभव नै उनीहरुलाई अलिकति गाह्रो पर्छ। तो कन्डक्ट डिसअर्डरमा चाहिँ अब के आउँछ भन्दाखेरि तीनवटा चीज आउँछ। एउटा चाहिँ अग्रेसन टु पिपल एन्ड एनिमल्स। के गर्छ भन्दा यो नानीहरुले चाहिँ अरूहरुलाई हेपेको जस्तो के बुली गर्छ भन्छ नि, अनि अरूहरुलाई थ्रेटन गरेको जस्तो, इन्टिमिडेट गरेको जस्तो, झगडा पर्ने या कोहीले त यस्तो वेपनहरु के छुरीहरु के ले अर्कालाई सिरियस हार्म पनि पहुँचाउन सक्छ। अनि फिजिकली क्रुअल अल्सो टु पिपल एज वेल एज एनिमल्स र चोर्नु पनि उहाँहरूले गर्छ। अर्को चाहिँ के हुन्छ भन्दाखेरि अब डिस्ट्रक्सन अफ प्रपर्टी, डिसिटफुलनेस अर थेफ्ट भनेको चाहिँ अरूहरुको घरमा गएर या आफ्नो प्रपर्टीहरुमा हैन अलिकति हानि पहुँचाउनु। जसरी अब बिल्डिङ नै होस् या क्लासरुममा चौकीहरु यस्तो टेबलहरु भत्काएर अर्काको गाडी सामानहरुलाई भत्काएको जस्तो गरेर र चोरीहरु पनि गर्नु सक्छ। अनि उनीहरु चाहिँ एकदमै ज्यादा कोही बेला ढाँटेको जस्तो पनि लाग्ने हैन, एकदमै त्यो गरेको, र उनीहरुलाई पनि रुल्सहरुसँग केही ज्यादा मतलब हुँदैन। भनेको कुरा नमानेर आमा बाउले नजा भनेको ठाउँमा पनि जाने या राति बाहिर साथीहरूसँग डुलेर घर फर्केर नआउने या स्कुल भागेर कता कता जाने हैन त्यो चाहिँ यस्तो चाहिँ नानीहरूलाई चाहिँ अलिकति हामीले कन्डक्ट डिसअर्डर भनेर भनिन्छ सो यस्तो भयो भने पनि अब उहाँहरूलाई चाहिँ सानोदेखि नै इफ वी क्यान इन्भल्भ देम इन सम सर्ट अफ एउटा ट्रेनिङ चाहिँ दे माइट बी एबल टु इम्प्रुभ ओके सो अब यस्तो नानी कन्डक्ट डिसअर्डर भयो भने चाहिँ के हुन्छ भन्दाखेरि अब होइन सम्हाल्नु नै अलिकति साह्रो पर्छ सो लट अफ टाइम्स यो नानीहरू चाहिँ बेसी बदमास भयो भनेर स्कुलले पनि अब सस्पेन्ड गर्यो भने अलिक ठिक हुन्छ कि बा भनेर होइन कि कतिजनाले चाहिँ अब तपाईँहरूको यो नानीहरूमा नै कतिजना जुवेनाइल केसमा फस्यो भनेर तपाईँहरूले बुझ्नुहुन्छ होइन सो मेबी वी क्यान सस्पेक्ट द्याट मेबी सम अफ दिस चिल्ड्रेन मे बी ह्याभिङ कन्डक्ट डिसअर्डर a lot of children experiment very early with sexuality त्यसले गर्दाखेरि sexually transmitted disease या झगडाहरू परेपछि उनीहरूले अर्कालाई मारपिट गरेर या आफै पनि एकदमै चोटहरूमा परिरहेको हुन्छ अनि अलमोस्ट अल रिस्क टेकिङ बिहेभियर चाहिँ यिनीहरूमा अलिकति हाई नै हुन्छ होइन जसरी अब मदपानको सेवन गर्नु या टोब्याको युजहरू अलिकति उनीहरूले छिटो एउटा इस्तेमाल गर्नु थाल्छ या रेकलेस र रिस्क टेकिङ बिहेभियर भन्छ नि अब नजाने ठाउँमा जाने नगर्ने चिज अब नानीहरूले गर्ने चिजहरू त्यहाँ गर्नेहरू त्योहरू चाहिँ अलिकति उनीहरूले गर्छ सो नाउ with this we come to the end of the problematic part of the presentation okay अब यसमा तपाईहरुलाई के क्वेशन छ भने एक दुईवटा क्वेशन म लिइहाल्छु है अनि त्यहाँदेखि we'll go on to what can we do भनेर चाहिँ नि for children who are having any kind of some trauma neglect or any kind of issues है so presentation stop गरेर एक दुईवटा क्वेशन चाहिँ अब म लिन्छु है कसैलाई के सोध्नु छ अहिले बुझ्नु भयो या तपाईहरुको फिडब्याक छ भने पनि तपाईहरुले भन्नु सक्नुहुन्छ सबैजनाले भिडियो पनि अफ गर्नु भएको रहेछ कसलाई देख्दिन पनि रहेछु So looks like हैन आज कोही नबोल्ने रहेछ म मात्रै बोल्नु पर्ने रहेछ so okay so I'll move on with the presentation okay. So now we'll move on with something that we all know about and we've been dealing with again but hopefully this will be like a refresher for you so what we're going to talk about now is trauma okay so तपाईहरुले सबै बुझ्नु नै भएको होला trauma चाहिँ धेरै प्रकारको हुन सक्छ एउटा चाहिँ भावनात्मक रूपमा हुन सक्छ एउटा चाहिँ साइकोलोजिकल रूपमा हुन सक्छ एउटा चाहिँ फिजिकल रूपमा पनि हुन सक्छ हैन so these are the effects of trauma which is left because of some sort of increased एउटा stress भएको हुन्छ which is caused by again some sort of threat or violence or life-changing event in the life of anyone okay so be it a child or be it an adult उनीहरुलाई चाहिँ यस्तो एउटा घटना भएको हुन्छ जसले चाहिँ उहाँहरुको इमोशनल उनीहरुको साइकोलोजिकल र उनीहरुको फिजिकल एउटा रूपमा नै एउटा इफेक्ट परेको हुन्छ so यो ट्रमा भनेको चाहिँ sometimes it is a effect that is more के भन्छ overwhelming भनेर चाहिँ एउटा हामीले बुझ्छ ओके दैट इट इज अब हामी सबैलाई स्ट्रेस हुन्छ डेली तर त्यो भन्दा चाहिँ बढेर के हुन्छ भनेर ओके so अब when we look at trauma in young children research has shown that 1 in 4 children at least in the west experience traumatic events in their childhood okay now some children may experience more number of trauma some children may experience small trauma but at a repeated टाइम त्यसले गर्दाखेरि चाहिँ त्यो क्युमुलेटिभ इफेक्टले गर्दाखेरि चाहिँ तिनीहरुको ट्रमा चाहिँ झन् बेसी हुन्छ बुझ्नुभयो एउटा चाहिँ अब लेट्स से यो चाइल्ड अब पोक्सो केस हो भने देयर इज वन इभेन्ट वेयर इट इज अ ग्रेभ इभेन्ट तर इफ इट इज फिजिकल बिटिङ एभ्री डे हैन कि खाना न अब राम्रो नदिएको नानीहरुलाई एभ्री डे भएपछि चाहिँ काल खाना दिनम त त्यत्रो ठुलो बढी बात छैन तर सधैँ नै आमाले बाउले यादै गरेन निग्लेक्ट सधैँको लागि भन्छ त्यो चाहिँ झन् क्युमुलेटिभ भएर जान्छ नि हैन त्यसले गर्दाखेरि चाहिँ इदर वन बिग टु बिग और स्मल स्मल विच मेक्स इट बिग मेक्स चिल्ड्रन भल्नरेबल ओके सो त्यसले गर्दाखेरि उनीहरुको चाहिँ एउटा स्ट्रेस रिएक्सन बनिन्छ त्यसले गर्दाखेरि चाहिँ नानीहरुमा चाहिँ के हुन्छ डिफिकल्टी आउँछ केमा आउँछ कन्सन्ट्रेसनमा अरूहरुसँग बर्ताव कसरी गर्ने या आफ्नो जुन कुरा गर्नुपर्ने अब नानीहरुको लागि त सानोमा त एकाडेमिक्समा नै धक्का पर्छ सो what we must remember is that every child reacts to trauma differently अब जस्तो तपाईहरुको सीसीआई मा नानीहरु आउँछ कोही नानीहरु हामी यसो देख्छ ठुलो घटना भइराको हुन्छ तर त्यो नानीहरुलाई त्यति डरलाग्दो फरक नपरेको जस्तो लाग्छ फेरि कति जनालाई चाहिँ सानो कुराले पनि ठुलो फरक परेको जस्तो लाग्छ हैन सो के किन हुँदा रहेछ भन्दाखेरि चाहिँ बिकज इट डिपेन्ड्स अन द चाइल्ड्स डेभलपमेन्टल लेभल हैन कति सानो छ नानी कतिवटा बुझ्ने शक्ति कतिको डेभलप भएको छ नानीकोमा र यो घटना हुनुभन्दा अगाडि नानीको फंक्सनिङ कस्तो थियो प्री मोर्बिड फंक्सनिङ भन्छ त्यसलाई चाहिँ हैन के घटना हुनु अगाडि चाहिँ नानी कतिको फंक्सन गर्दै थियो र उसको पहिलाको लाइफ एक्सपिरियन्स कस्तो थियो पोजिटिभ थियो भने अरूहरुले सपोर्ट गर्यो भने त्यो नानी माइट बी एबल टु गेट आउट अफ इट प्रिटी वेल त्यहाँदेखि लेभल अफ एक्सपोजर टु द ट्रमा अघि भने कि बारम्बार एक्सपोज भयो भने त ट्रमेटिक रिपिट एउटा ट्रमेटिक एक्सपिरियन्स हुन्छ र पेरेन्टल या केयर गिभर रिएक्सन कस्तो हुन्छ अब आमा बाउले ला भनेर गर्यो भने कस्तो खालके रिएक्सन हुन सक्छ या उनीहरुले कसरी नानीलाई सम्हालेर सपोर्ट गर्यो भने रिएक्सन अलिकति राम्रो हुन सक्छ र whether the child after the trauma living situation अब place of safety त तपाईहरु भइहाल्यो हैन so whether the some children are able to go into a place of safety or not some children अब if the trauma is not known त्यही त्यो re-trauma भइबस्छ ओके so हामीले चाहिँ के बुझ्नु पर्यो भने many children are resilient भनेको चाहिँ उनीहरुलाई त्यति धेरै इफेक्ट पर्दैन ओके सो कति जनालाई नानीहरुलाई चाहिँ तर पर्छ भनेर चाहिँ तपाईहरुलाई पनि थाहा छ सो अब व्हाट आर द टाइप्स अफ ट्रमा हैन त्यो पनि तपाईहरुले बुझिसक्नु नै भएको होला सो फ्यामिली भाइलेन्स हुन सक्छ मेडिकल ट्रमा नै हुन सक्छ नेचुरल डिजास्टर्स जस्तो अब अर्थक्वेक भएपछि हैन या फ्लड आएर घरबार बिगाड्दियो भने हैन नर्मल डे टु डे लाइफ डिस्टर्ब गरिदियो भने ओके और लाइक लेट्स से नाउ इन अब ग्लोबली नै अब हाम्रो कोभिड अल्सो इज कन्सिडर्ड सम सॉर्ट अफ अ नेचुरल डिजास्टर ओन्ली ओके अब नट सो मच इन इन्डिया तर अब युएस हरुतिर कम्युनिटी स्कुल भाइलेन्स पुरा छ स्कुलमा हैन गन्सहरुले नानीहरुलाई मारेर के पुरा हुँदाखेरि लट अफ अदर चिल्ड्रन इभन इफ दैट ह्यापन्स दे आर अल्सो ट्रॉमेटाइज्ड देन व्हाट वी आर प्रोबेबली मोर आई थिंक यूज्ड टु इज अब नानीहरुको नेग्लेक्टमा फिजिकल अब्युज हैन फिजिकल अब्युज भनेको चाहिँ पिट्नुमा मात्रै हैन अरु त्यहाँदेखि मेन्टली पनि हामीले अब्युज गर्न सक्छ हैन ताना दि बस्नु अर्कालाई नराम्रो गरी बस्यो भने पनि हैन त्यहाँदेखि आइ एम श्योर अल अफ यु नो सेक्सुअल अब्युज के हो हैन त्यहाँदेखि ट्रमेटिक ग्रिफ भनेको चाहिँ when maybe one of the caregivers आमा बाउ सानोमै खसेर नानीहरुलाई त्यसमा पनि ट्रमा हुन सक्छ र नाउ इफ यु लुक एट लट अफ चिल्ड्रन इन यु नो war areas अहिले युक्रेनको नानीहरुलाई पुरा प्रब्लम भइराको छ हैन सो all these things may come up at the effects of this trauma may be seen immediately as acute stress or it may come as the child develops further अब how does it affect अब normal brain functioning हेरिहाल्नुस् on the left side हैन र एक्सट्रीम निग्लेक्ट भएको नानीहरुको हेर्नुस् त्यहाँ कालो कालो दाग बेसी देख्नु हुँदैछ नि त्यसको मतलब चाहिँ के हो उनीहरुको न्यूरोनल ब्रेन डेभलपमेन्टमा नै धक्का परेको छ दैट मीन्स सम ब्रेन डेभलपमेन्टमा प्रब्लम भएपछि चाहिँ कतिवटा अब त्यो ब्रेन नै कम्ती छ नि त यसो हेर्दाखेरि नै तपाईहरुले बुझ्नुहुन्छ हैन यो ब्रेन नै अलिकति श्रिङ्क भएको जस्तो छ अब त्यो ब्रेन नै कम्ती छ भने उनीहरुको बुझ्ने शक्ति गर्ने शक्ति या जुन चाहिँ ब्रेन पार्ट इफेक्ट भएको छ त्यो पार्टको फंक्सनिङ नै इफेक्ट भएर जान्छ ओके सो इफेक्ट गर्छ बडीलाई इफेक्ट गर्छ र रिलेसनशिप्सहरुमा पनि इफेक्ट पार्छ अब तपाईहरुले लेफ्ट साइडमा हेर्नुभयो भने कन्टेक्स्ट चाहिँ के हो इन्टरजेनरेशनल ट्रमा भन्छ त्यो चाहिँ अब फ्यामिलीजमा एक प्रकारको एउटा चलिआएको कुरा पनि हुन्छ ओके त्यो चाहिँ अब एन्ड यसो अब तपाईहरुले सुन्नु भएको छ नि एन अब्युजर इज अ पर्सन हु हेज बीन अब्युज्ड इन द पास्ट बिकज दे हेभ बीन इन्ट्रोड्युस्ड टु अब्युज हैन अब हामीले मैले नजानेको कुरा मैले गर्नु सक्दिन होला तर मलाई अब कोले पिटेको छ भने पिटेको छ भने मेरो पनि फर्स्ट इन्स्टिंक्ट माइट बी टु beat up somebody else okay so हो त्यसरी नै अब एउटा इन्टरजेनरेशनल फ्यामिलीमा देखिराको या कम्युनिटीमा भइराको कुराहरु चाहिँ हामीले त्यही चीज गर्छ भन्छ नि हो त्यो चाहिँ त्यही कारण इन्भाइरोन्मेन्ट इज भेरी भेरी इम्पोर्टेन्ट सो व्हाट काइन्ड अफ इन्भाइरोन्मेन्ट हामीले त्यो भ्याल्युज को कुरा गर्छ हैन अब इन्भाइरोन्मेन्टको कुरा गर्नु पर्यो भने अब a lot of studies also say कि अब सिक्किममा मदपानको सेवन सानोदेखि अब गाउँ बस्तीमा चलिरहेको हो भने नानीहरूले पहिला दिन देख्छ नि त हैन त्यसले गर्दाखेरि त्यो चाहिँ ठिकै हो भनेर चाहिँ उहाँहरूले बुझ्न सक्छ सो दोज आर द थिंग्स दैट वी टकिङ अबाउट कन्टेक्स्ट सो कन्टेक्स्ट इज भेरी इम्पोर्टेन्ट अर्को चाहिँ के हो स्पिरिचुअलिटीमा के छ अब हाम्रो कन्टेक्स्टमा चाहिँ अब हामीले स्पिरिचुअलिटीमा के बिलिभ गर्छ हैन हाम्रो भ्याल्यु सिस्टम के छ हामीले चोर्नु अब कतिजना अब कम्युनिटीज या रिलिजियस कम्युनिटीजले भन्छ यु विल गो टु हेल इफ यु स्टील और विल से दैट चोर्नु नराम्रो हो हैन सो आइडेन्टिटीमा के आएपछि भन्दाखेरि अब नाउ लट अफ अब पहिला हाम्रोमा यस्तो चलेर आएको थिएन तर अहिले नाउ वी सी अ लट अफ यङ चिल्ड्रन एक्सपेरिमेन्टिङ विथ द सेक्सुअलिटी हैन सेम सेक्स पार्टनरहरुमा एट्र्याक्सन हुन सक्छ हैन अहिले त झन् धेरै ओपन हुन थालेकोले गर्दा झन् धेरै मान्छेहरुले भन्नु थालेको छ सो नाउ यु सी that as times change also problems will also be different because of the context and the environment that we are in and this will affect now all sorts of problems अब mind लाई कसरी affect गर्छ भने हाम्रो सोच्ने शक्तिमा प्रब्लम आउन सक्छ रिजन गर्ने हैन लजिकमा प्रब्लम आउन सक्छ बोल्नेमा ल्याङ्ग्वेजमा कम्युनिकेसनमा या अब एटेन्सनमा नै प्रब्लम भएपछि त हामीले ध्यान दिएन भने सिकेन भने हामीले त्यसलाई बादमा याद गरेर भन्नु पनि सक्दैन अलराइट सो माइन्डको क्यापेसिटी नै हाम्रो घट्छ त्यहाँदेखि बडीमा के इफेक्ट हुन सक्छ भन्दाखेरि हाम्रो फिजिकल हेल्थमा हामीले ज्यादा ध्यान नदिनु सक्ला एउटा चाहिँ सेल्फ हार्म बिहेभियर कतिजना अब्युज नानीहरूले एकदमै यु नो वी हैव सीन इन द हस्पिटल सेटिङ अल्सो एकदमै उनीहरूले इमोसनहरु चाहिँ कन्ट्रोल गर्नु नसक्दा उनीहरूले अब मर्नुलाई हैन तर इमोसनल रिलीज गर्नुको लागि हातहरु पुरा काटेर आएको हुन सक्छ ओके कतिजनालाई स्लीप प्रब्लम्स हुन्छ कतिजनालाई एडिक्सनको प्रब्लम पनि हुन सक्छ अब नानीहरुलाई जब ट्रमा भयो भने चाहिँ दे हैव इवन व्हेन अडल्ट्स हैन we have biologically we get into what is known as survival mode हैन अब तपाईलाई कोले अट्याक गर्नु आयो भने पनि तपाईले के गर्न सक्नुहुन्छ कि तपाईले झगडा गर्न सक्नुहुन्छ हैन त्यो मान्छे त्यति ठुलो छैन भने तपाईहरुले पनि फाइट गर्न सक्नुहुन्छ कि फ्लाइट भनेको चाहिँ भाग्नु सक्नुहुन्छ कि डरले हामी फ्रीज हुन सक्छ सो सेम थिङ फर चिल्ड्रन सो example of child A who has been abused at home and is now living with foster carers he overhears his foster carers arguing हैन उनीहरु अलिकति आर्गुमेन्टमा डिस्कसन पर्दै छ भने because of his previous experience okay so पहिला ट्रमाटिक ट्रमा भएकोले गर्दाखेरि चाहिँ अहिले अब यो नानीको डर पैदा हुने एकदमै डर as a reaction will be quick so he will feel that oh he might be attacked again so that will send his body into survival mode अब त्यो सर्भाइभल मोडमा गएपछि चाहिँ के हुन्छ त्यहाँदेखि कि उलाई हैन झगडा गर्नु मन लाग्न सक्छ कि उलाई लुक्नु मन लाग्न सक्छ कि हैन इन्क्यापेसिटेट भएर इमोबिलाइज भएर के पनि के भन्छ फ्रीज हुन सक्छ ओके सो दिस आर द थ्री थिंग्स दैट माइट ह्यापन सो अब आई जस्ट गो थ्रु a few of these because of lack of time I can send you all the slides so you can see about different ages of नानीहरुले चाहिँ different types of reaction हुन सक्छ हैन ट्रमा भयो भने अब if you look at very young children, they might avoid eye contact, उनीहरूको sleep या उनीहरूको eating pattern मा disruption हुन सक्छ, उनीहरूले गरिसकेको हैन अब हातहरु खुट्टाहरु चलाउन सकेको गर्दै गरेको चीजहरुमा उनीहरूले त्यसमा फेरि उनीहरूको रिग्रेस भएर चाहिँ उनीहरूले नगर्नु सकेको जस्तै हुन सक्छ, छिट्टो रिसाएको जस्तो ओके, अरूहरूले टच गर्दाखेरि के भन्छ अनकम्फर्टेबल लागेको जस्तो ओके, सो अल दिस हुन सक्छ उनीहरुलाई। अनि त्यहाँदेखि कतिजना चाहिँ नम्ब क्या एकदमै इमोसनै देखाउनु नसकेको जस्तो, कि कतिजना नानी चाहिँ अब इफ इट्स अ सेक्सुअल अब्युज अलिकति यु क्यान सी सम सर्ट अफ जेनाइटल पेन, अलिकति त्यहाँ इन्फ्लेमेसन भएको जस्तो, ब्रुजिङ, ब्लिडिङ ओके, सम सर्ट अफ सेक्सुअली ट्रान्समिटेड डिजिज त्यो पनि हुन सक्छ, कि कोही एकदमै के चङ्खी नानी त सडनली हैन केही इन्ट्रेस्टै नदिएको जस्तो के एकदमै त्यो फ्रिज भएको जस्तो, कि एकदमै घबराएर छिट्टो रुएकै गरेको जस्तो। सो लट अफ दिस काइन्ड अफ अलिकति अनौठो बिहेभियर गर्नु थालेपछि चाहिँ तपाईहरुले अलिकति सतर्क हुनु पर्यो। अलराइट, सो similar issues might be there for older children also. Now I don't want to go through all of these, okay? So lack of focus, lack of concentration, body aches and pains हरु कम्प्लेन गर्न सक्छ अलिकति ठुलो नानीहरुले हैन। त्यहाँदेखि टोयलेट ट्रेन भइसकेको नानीहरुले फेरि एकदमै के भन्छ लुगामै लङ टोयलेट या सर्ट टोयलेट गर्ने यस्तोहरु हुन सक्छ ट्रमा भएपछि, या राति निन्द्रामा प्रब्लम भएको जस्तो हैन, र अरूले कम्फर्ट गर्नु खोज्दाखेरि हैन सन्तावना दिनु खोज्दाखेरि पनि एकदमै नमानेको जस्तो, या मुड या आफ्नो स्वभावमा अलिकति पर्सनालिटी चेन्जेस भएको जस्तो हुन सक्छ। अलराइट, या हैन एकदमै आएर मिलजुल गर्ने नानीहरु सडनली चुबो लागेको जस्तो, एकदमै क्वाइट भएको जस्तो या डराइरहेको जस्तो देख्ने, कि अरूहरुसँग खेल्दाखेरि हैन अलिक प्ले बिकम्स अ लिटल डिफरेन्ट, कि उनीहरूले त्यो नै रिपिट गरिबस्ने, या एउटा ट्रमा रिलेटेड प्ले पनि उनीहरूले गर्नु सक्छ हैन व्हेन दे आर नट एबल टु एक्सप्रेस, किनभने 3 to 5 इयर्सले त राम्रो गरेर कम्युनिकेट गर्नु सक्दैन, भन्नु सक्दैन, त्यसले गर्दाखेरि ओके। So similar things you'll see in older children also हैन, कि डराइरहेको जस्तो एकदम हाइपर भिजिलेन्स भन्छ, कि अपि कोले के भन्छ, कि कोले हिर्काइ पो हाल्छ, कि कोले के चङ्खे भएर बसिरहेकोहरु पनि that could also be one of the signs okay। सो कतिजनाले चाहिँ त्यहाँ अलिक ठुलोहरुले चाहिँ एक्टिङ आउट बिहेभियर पनि गर्नु सक्छ हैन, त्यो अलिकति ज्यादा नै प्याउले भएको जस्तो पनि देख्नु सक्छ, इटिङ डिस्टर्बेन्स, पढाइहरुमा प्रब्लम भएको, कन्सन्ट्रेसन मेमोरीमा प्रब्लम भएको जस्तो त्यस्तो हुन सक्छ ओके। र कतिजना डिप्रेस देख्नु सक्छ, कतिजना हैन एङ्ग्सियस देख्नु सक्छ, अनि छिटो इमोसनल भएको जस्तो, र एकताल इमोसनल भएपछि चाहिँ फेरि नर्मलमा आउनु नसकेको जस्तो ओके। सो अल दिस आर थिङ्स व्हिच यु क्यान देन दे माइट यु नो feel scared to have relationships with elders or with friends त्यस्तो खाली ओके। सो हाम्रोमा चाहिँ के इम्पोर्टेन्ट छ भने चाहिँ अब तपाईहरुको नानीहरुकोमा चाहिँ अब राम्रै भएको नानीहरु पनि कग्निटिभ क्यापासिटी कम्ती भयो कि, स्लीप डिस्टर्बेन्स भयो कि, याददाश्तमा प्रब्लम भयो कि हैन, कि अब सोशल रिलेसनशिपमा अरूहरुसँग अलिक जग्रिलो पो हुन थाले कि एट्याचमेन्ट डिफिकल्टीज, कि अरूहरुसँग मिलेर एकदमै हैन एकदमै झुन्डी बस्ने आमा बाउसँग या तपाई केयररहरुसँग या अरूहरुको छेउमै नजाने, अरू साथीहरुसँग रिलेसनशिप नै बनाउनु नसक्ने ओके। सो दोज थिङ्स आर सम थिङ्स दैट माइट गेट अफेक्टेड। सो all these are, this is just a diagrammatic this thing that when there is too much stress के हुन्छ, र traumatic stress चाहिँ is more than too much stress हैन। यहाँ हेर्नुस् त अब पुरै रिसाउने नाइटमेयर हुन सक्छ उहाँहरुलाई, त्यो ट्रमा त्यो के त्यो पिटेको या के भन्छ सेक्सुअल अब्युजको रिपिटेड फ्ल्याशब्याक आउन सक्छ, अलवेज अन गार्ड हैन, के होला फेरि के हुन्छ कि भनेर अलिकति धेरै नै प्रब्लम हुन सक्छ। अब हामी एज केयरर्स व्हाट क्यान वी डू हैन, दैट इज द मोर इम्पोर्टेन्ट थिङ। सो trauma has an impact in numerous ways, but there are messages of hope. जसरी अघि मैले भने नानीहरु they are pretty resilient okay। So one thing what we can do is we can help them by building a relationship with them, which I'm sure all of you are already doing हैन। तपाईहरुले रिलेशनशिप बिल्ड गर्नु पर्यो नानीहरुसँग, And as you all are already doing as under CCIs, ensure that children are safe. So they are safe from the perpetrators of harm, but within your own CCIs also, how is the safety aspect of it? त्यो चाहिँ तपाईहरुले अलिकति याद गर्नु पर्यो कि अरु नानीहरुले उसको अलिकति खिल्ली पो उडाको छैन कि बा कि अझै बुली पो गरेको छैन कि बा हैन त्यो पनि अलिकति हामीले याद गर्नु पर्यो या otherwise is your traumatic child bullying or harming others. Okay, so it can work both ways. And how can we help? By supporting calming of mind and body. So these are things that you can do as in a routine way. Routine राख्यो नानीहरुलाई आजकल हैन, give them some exercises, some sort of yoga हरु पनि आजकल पुरा स्कुलहरुमा पनि सिकाउँदैछ. So all those things you can do. And then again, what we can also do is re-establish learning confidence in small steps. And then we can build on there उनीहरुको क्षमता हैन, कोपिङ कसरी गर्ने, उनीहरुको त्यो प्रब्लमहरुसँग सामना गर्ने क्षमता हामीले कसरी उनीहरुको बढाउने भनेर चाहिँ त्यसमा हामीले फोकस गर्न सक्छ. अब we'll try to focus on the last 2 points, okay, because the first 3 points हरु त तपाईहरुलाई अब यादै छ हैन. So I wanted to make it a more practical kind of an experience for you. So one thing is, first के गर्ने तपाईहरुले, you'll as we have discussed so far, अहिले यति सारो हामीले डिस्कस गरेको नै के हो, we'll try to recognize the signs कि what are the signs of trauma that this child may be having. So because of certain issues like family violence, sexual violence, substance abuse, ama bauma, ya mental health issues in parents or carers, or neglect that might have happened for the children. Okay, so हामीले के गर्ने? So what we do is, now we are going to build connections with them. Okay, so as carers तपाईहरुले हैन बिहान बेलुका छुट्टीमा तपाईहरुले, now you will try to build some sort of connection with them. But अब त्यो connection त भन्यो, तर के connection? So the central concept in working with these children is to be in control of the relationship without being controlling. अब त्यो relationship कुन direction मा जान्दैछ त्यसमा चाहिँ तपाईहरुले control लिनुपर्ने, तर not being that अब मैले भनेको जस्तै गर्नुपर्ने, यही प्रकारले गर्नुपर्ने भनेर चाहिँ that becomes controlling. त्यो चाहिँ नगरेर you set the tone or the quality of the relationship, हैन, the emotional quality भन्छ नि, एउटा nice, एउटा warm खालके, but in a way which is setting limits also, हैन. सबै अब मैले माया गरेपछि हैन, सबै अब एउटा कनेक्सन भएपछि मेरो एडभान्टेज त लिनु दिनु भएन नि त, मेन कुरा चाहिँ त्यो भनेको. Okay, so everything should be done in some sort of limit, हैन. So what we do is, any kind of traumatic child, what we need to do is, first we need to understand the child, हैन. When the child first comes, or as the child starts staying in the CCI, ask if anything is happening in the child's life that might be contributing to their behavior, हैन. कति जना चाहिँ अब स्कुलमा कतिवटा प्रब्लम हुन सक्छ या बादमा पनि हुन सक्छ. Okay, so or some sort of problem may be contributing to their behavior. जसरी अब निन्द्रामा दिक्कत आइरहेको छ भने कन्सन्ट्रेट गर्नु सकेको छैन कि बा कि केले गर्दा चाहिँ कन्सन्ट्रेट गर्नु नसकेको. ओके, सो के कारणले चाहिँ हो भनेर चाहिँ त्यो चाहिँ हामीले बुझ्नु कोशिश गर्नु पर्यो. So sometimes we might need to take the help of other people, हैन, the school or the counselor, also if the child is going home, or if the parents सँग पनि भेटघाट हुँदैछ भने, या तपाई केयरर हैन अरे तपाई काउन्सिलर अरे, काउन्सिलर केयरर सँग कुरा गर्नुस्, केयरर काउन्सिलर सँग कुरा गर्नुस्, हैन. Okay, so if you all are not able to handle it, then you can obviously reach out to more specialized people like in the hospital. Okay, यानी कि main thing चाहिँ के हो, तपाईहरुको presence itself, तपाईहरुको support itself and your supervision itself is very important, हैन. तपाईहरु चाहिँ त्यहाँ छ, उनीहरु चाहिँ मेरो लागि छ भनेर एउटा तपाईहरुले एउटा वातावरण क्रिएट गर्नु भयो भने चाहिँ they'll always feel that, oh, someone is there for me. That sense of social support only is one of the biggest things that त्यो नै एउटा के हो, एउटा स्ट्रक्चर, एउटा रुटिन हो कि मेरोमा कोही छ, somebody who's going to take care of me भनेर त्यो एहसास नै तपाईहरुले दिलाउन सक्नु भयो भने पनि त्यो नानीहरुमा एउटा सेन्स अफ कम्फर्ट, एउटा एबिलिटी टु गेट आउट अफ द ट्रमा मा हेल्प गर्छ. किनभने for a lot of children, they come from those kind of environments, हैन? So sometimes you might not have to do anything, it might just help for you to sit close to the, हैन? कि त्यही रुममा छ भने भात पनि मारेन भने छौमा गएर यसो बसी मात्रै दिनुस् न नानीहरुको बीचमा, हैन? कि उनीहरु के भन्छ यताउता खेलिरहेको छ भने पनि तपाईहरु रुम भित्र नबसेर त्यहाँ गएर यसो बसेको जस्तो गर्यो भने पनि अन्त यसो हाँसेर उनीहरुले खेलेको जस्तो अब्जर्भ गर्यो भने नै they will feel that you care for them and that warmth is there. So keeping a close presence, अब बातचित मार्नु मन पर्यो भने पनि ठिकै छ, मन परेन भने तपाई आफ्नो काम गरिराको नै छ भने पनि हैन के एउटा क्याल्कुलेट गर्नु छ या के डकुमेन्टमा लेख्नु छ भने उनीहरु होमवर्क गर्दैछन् त्यहाँ बीचमा गएर सँगै गएर यसो गएर पछि बसिदियो भने पनि ए उनीहरु that some sense of एउटा कनेक्सन एउटा पार्टिसिपेसन चाहिँ छ भनेर चाहिँ so that you care for them भनेर एउटा सेन्स एउटा आउँछ उहाँहरुलाई. The other thing is अब नानीहरुले कोही बेला बदमासी त गर्छ, कोही बेला नचाहेको चीज पनि गर्छ, हैन? अटेरी पनि गर्छ. सो त्यति बेला चाहिँ तपाईहरुले आफ्नो के रियाक्सन छ, कस्तो पाराले रियाक्ट गर्नु हुँदैछ भनेर चाहिँ त्यसमा पनि अलिकति ध्यान दिनुपर्छ कि who doesn't get angry? I also get angry, you also get angry, you also feel hurt. Sometimes you might feel कि अब यसले मलाई किन यस्तो भनेको, हैन? So now you need to be aware of how children are able to push your buttons भन्छ नि कि तपाईहरुमा पो उनीहरुले पो कस्तो पाराले असर गर्दैछ. So you have to be aware of it. So when you are aware कि यसले यस्तो अब तपाईलाई याद छ नि कुन व्यवहारले तपाईलाई छिटो रिस उठ्छ या कुन व्यवहारले तपाईलाई मन दुखाउँछ या अपमान भयो जस्तो लाग्छ, हैन? So you know that. So when you know that you are getting angry or when you know that you are getting hurt yourself, त्यति बेला तपाई आफैलाई चाहिँ अगाडि नै आफैलाई काम डाउन गराउनु पनि कि ए म रिस उठ्दै छु. अब if you are aware of it then you can say कि रिसाउनु हुँदैन यो सिचुएसनमा भनेर तपाईले आफैलाई सन्तावना दिनु पर्यो, हैन? If you are not able to handle it then you ask someone else to take care of the situation or you ask help from anyone that you feel comfortable with to how to regain back your own composure, हैन? अब तपाईहरु नै आफ्नो भावना रेगुलेट गर्न सकेन भने कन्ट्रोल गर्न सकेन भने त प्रब्लम हुन्छ, हैन? तपाईहरुमा नै नकारात्मक एउटा इफेक्ट पर्छ. So त्यसले गर्दा we have to learn to manage our own reactions also because sometimes अब हाम्रोमा पनि नानीहरु आउँछ, they don't want to talk or they are very rude to us also. So त्यति बेला अब हामीहरुले त्यसमा चाहिँ कस्तो पाराले रियाक्ट गर्दैछ भनेर we also try to manage our own reactions. Okay. अब तपाईले के गर्नु सक्नुहुन्छ भन्दाखेरि then you can say that you can tell them something. All right. So you can say कि ए मैले देख्दै छु कि तिमीलाई चाहिँ यसमा चाहिँ हेल्प चाहिन्छ, हैन? So if the child is becoming disruptive or उले गर्नुपर्ने चीज गरेको छैन, हैन? So you can say that oh मैले यसो हेर्दाखेरि तिमीलाई यो क्लीन गर्नुमा अलिकति हेल्प चाहिन्छ कि I see that you need help with stopping hitting someone, हैन? Or not kicking the chair or not throwing things भनेर चाहिँ. So तपाईहरुले चाहिँ त्यो जुन चाहिँ एक्टिभिटी मन परेको छैन जुन चाहिँ नानीले गर्दैछ, हैन? त्यसलाई तपाईले हाइलाइट गरेर भन्नुस् कि ए लुक्स लाइक यु नीड तपाईलाई चाहिँ यसमा चाहिँ अलिकति हैन नगर्नुको लागि चाहिँ सहायता चाहिन्छ भनेर. ओके. सो त्यो भन्दा नि ए त्यो नानीले अलिकति बुझ्छ कि ओ यु आर लुकिङ एट द बिहेभियर एन्ड नट द चाइल्ड इन टोटालिटी, हैन? किनभने यो नानीहरुलाई चाहिँ यो नगर भनेर अरूले पनि भनेकै हुन्छ, हामीले पनि भन्दाखेरि उनीहरुले सायद बुझ्दैन होला किनभने द वे दैट दे आर अट्याच्ड टु उनीहरुको जुन चाहिँ रिलेशनशिपमा नै कनेक्सन फर्म गर्नेमा नै उनीहरुको सायद कोही बेला बाधा परेको हुन्छ, हैन? किनभने अब रिपिटेड अब्युज भइराको बेलामा या फिजिकल निग्लेक्ट भइराको बेलामा उनीहरुको अडल्टसँग त्यस्तो राम्रो कनेक्सन भएको हुँदैन, यु नो? सो त्यसले गर्दाखेरि चाहिँ उनीहरुको कुरा किन सुन्नु भनेर एउटा सायद that is the concept that they have there in their mind. Okay, so telling them might not help, but going to them telling them not to do might not help, but you saying come isma problem cha timilai, come let's see what can we do about it भनेर सँगै let's do it together भनेर चाहिँ तपाईले त्यस्तो पाराले चाहिँ तपाईले रियाक्ट गर्नु पर्यो. अर्को चाहिँ I'm sure this is already being maintained, but it is always important to have some sort of routine and consistency in behavior. Consistency भनेको चाहिँ आज हामीले अब एउटा नानीहरूलाई भन्यो कि अब आजदेखि हामीले यस्तो पाराले प्लेटहरू सबै यहाँ राख्नुपर्छ या किताबहरू सबै यहाँ राख्नुपर्छ भन्यो, तर अर्को दिन नानीहरूले अर्को ठाउँमा राख्दाखेरि हामीले ठिकै छ जस्तो एक्टिङ चाहिँ नगरेर लु यो भनेपछि हैन एउटा कन्सिस्टेन्सी हुनु पर्यो नि कि यो गर्यो भने म खुसी हुन्छु, आज खुसी भयो तर भोलि त्यही उले गर्यो तर म खुसी नै देखाइन भने देयर इज नो कन्सिस्टेन्सी. सो त्यसले गर्दाखेरि वी मस्ट सी दैट हाम्रो बिहेभियर इज कन्सिस्टेन्ट with what the child is doing also. Okay, why भन्दाखेरि चाहिँ नानीहरुकोमा अगाडि नै इन्कन्सिस्टेन्सी भइराको हुन्छ. Okay, so त्यसले गर्दाखेरि स्पेशली फर चिल्ड्रन दे डोन्ट ह्याभ द एबिलिटी टु स्ट्रक्चर, सो वी नीड टु ब्रिङ अबाउट दैट स्ट्रक्चर इन देयर लाइव्स. सो त्यसले गर्दा अब तपाईहरुकोमा त रुटिन त छँदै नै छ होला, तर इफ देयर इज एनी अदर चेन्ज इन रुटिन लेट अस इन्फर्म देम इन एडभान्स सो दैट एउटा अचानक एउटा रूल बनाएको हैन अब सडनली त्यसो नगर्नु यो गर भनेर नगरेर चाहिँ अब हामीले यस्तो भयो अब भोलिदेखि चाहिँ हामी यस्तो गर्ने भनेर चाहिँ एउटा तपाईहरुले इन्फर्मेसन दियो भने देन दे विल अल्सो बी प्रिपेयर्ड फर इट. सो फ्रम टुडे द म्युजिक टिचर चाहिँ अलिकति बिमारी हुनुभएछ या आउनु सक्नुहुन्न, त्यसले गर्दाखेरि आजदेखि हामी म्युजिक नगरेर भोलिदेखि के भन्छ हामीले चाहिँ आर्ट गर्नुपर्छ या अहिलेको टाइममा चाहिँ अब के भन्छ क्लासरुममा नगएर अब वी विल स्पेन्ड सम टाइम आउटसाइड भनेर चाहिँ हामीले एउटा इन्फर्मेसन पनि दिनु पर्यो र क्लोजली त्यति बेला चाहिँ हामीले अब यो जुन चाहिँ पनि हामीले बदलाव ल्याउँदैछ या जुन चाहिँ पनि ट्रान्जिसन ल्याउँदैछ त्यति बेला चाहिँ हाम्रो फिजिकल प्रेजेन्स इज इम्पोर्टेन्ट. हामीले अलिकति सुपरभाइज गर्नु पर्यो, अलिकति जो नानीहरूलाई हैन अब स्पेशली कतिजना नानीहरूलाई चाहिँ रुटिनमा चेन्ज हुँदाखेरि पनि एकदमै प्रब्लम हुन्छ. तो त्यति बेला उनीहरूले एक्टिङ आउट बिहेभियर गर्नु सक्छ, नमान्नु सक्छ हैन कि अलिकति एङ्ग्सियस हुन सक्छ. त्यसो त्यति बेला वी नीड टु सपोर्ट दिस चिल्ड्रन. सो दैट इज इम्पोर्टेन्ट. एन्ड अब यो स्ट्रक्चर र कन्सिस्टेन्सीमा हेर्यो भने चाहिँ सपोज यु नो यु हेभ सम स्मल प्ले ग्राउन्ड आउटसाइड ओपन स्पेस इन एन अब हैन प्ले टाइम हो जे गर्दा पनि हुन्छ भनेर चाहिँ हैन. सो इभन इन अनस्ट्रक्चर्ड टाइम कोही नानीहरू के गरौँ अन्त यताउता कुदेर त्यस्तो पनि हुनसक्छ. सो वी निड टु बी एबल टु सुपरभाइज देम, स्पेशली अब कोही नानीहरू भर्खर आएको हुन्छ, कोही नानीहरू बसिरहेको हुन्छ, पहिलादेखि नै बसेको हुन्छ. सो मेनी चिल्ड्रन निड टु काइन्ड अफ ट्राई टु गेट टु फर्म कनेक्सन्स विथ इच अदर अल्सो हैन. सो त्यसमा हामीले अलिकति सपोर्ट दिएर कि कोही घुमसुम भएर बसेको छ भने आउ न उनीहरू लुडो खेल्दैछ आउ तिमी पनि आउ यसो गरेर खेलौँ भनेर हैन. सो सम सर्ट अफ एउटा सुपरभिजन इफ वी क्यान जेन्टली पुश देम. एन्ड if you see that there are problems which are happening, some children are being aggressive, some people are bullying each other, so त्यति बेला चाहिँ we need to be able to address these problems directly and calmly as they arise हैन. हुँदै गर्दाखेरि नै हामीले काम भएर नै त्यसलाई ह्यान्डल गर्न सक्यो भने र एउटा क्लियर डाइरेक्सन दिनु हैन. अब युजुअली हामीले के भन्छ त्यो नगर चाहिँ अब एज अडल्ट्स अल्सो इट इज भेरी इजी फर अस एन्ड द्याट इज द फर्स्ट थिङ द्याट कम्स. तर के गर्नु भनेर चाहिँ हामीले भन्नु पर्यो. ओके, नगर्नु चाहिँ हैन अब लु चुप लागेर बस हैन, हल्ला नगर पनि इज द सेम थिङ, चुप लागेर बस पनि इज द सेम थिङ हो कि हैन भन्नुस् त. सो हल्ला नगर नभनेर अब सबैजना 5 मिनट काम गर्दाखेरि नबोल्ने के भन्छ क्वाइटली बसेर गर्नुपर्छ भन्यो भने इट्स लाइक अ क्लियर डाइरेक्सन कि यो होमवर्क गर्दाखेरि कोही पनि बोल्दैन अब हैन. अन्त बोलेन भने त्यहाँदेखि सबैजनालाई डिस्टर्बेन्स हुँदैन. ओके, सो त्यो भएपछि चाहिँ के भन्छ I will give you 5 minutes extra to play, or you know if you will continue to do this activity in a nice way for the whole week म के भन्छ तपाईहरुलाई half an hour TV बेसी हेर्नु दिन्छु weekend-मा. Okay, so with a clear direction and an outcome which is controlled by you. Okay, so that children know that in the end I know उनीहरुले गर्नुपर्छ and किन गर्नुपर्छ because you want it, तर it should not be an unreasonable request. Okay, so अब लेट्स से एउटा नानी पुरा उताउलो गरेर यताउता गर्दैछ भने औ के भन्छ आज अब थुप्देन चाहिँ बसेर राम्रो गरेर 2 मिनेटको लागि यो लेख्छ हैन यो लेखेपछि चाहिँ त्यहाँदेखि आई विल गिभ यु अ ब्रेक त्यहाँदेखि चाहिँ तिमी बाथरुम जाऊ तिमी बाहिर जाऊ ओके सो त्यसो गर्यो भने सो दैट आउटकम तपाईले नै डाइरेक्सन दिँदैछ नि उसको मनमा नि चलेन नि त ओके सो त्यो चाहिँ तपाईले कन्सिस्टेन्टली गर्यो भने औ तिमीलाई प्रब्लम भयो आई सी दैट यु नीड हेल्प विथ doing your homework, come sit down, or you need some problem, you are having problem with attention, so come sit down, let's see what we can do about it bhanera haina so we will need to help them with that. So children will respond to structure and kati janale chai aba हामीले चाहिँ अब I don't know how used to all of you होला हामीले चाहिँ अब behavioral problems छ भने चाहिँ कति जना नानीहरुको नाम लेखेर यस्तो चार्टमा हैन आज दिनभरि सबै चुपो लागेर बसे भने एउटा स्टार दिन्छ ओके सो 10 वटा स्टार पायो भने चाहिँ एउटा के भन्छ मिठाई पाउँछ या उलाई चाहिँ के भन्छ फ्रन्टमा बस्नु पाउँछ या टिभी हेर्दाखेरि राम्रो सिटमा बस्नु दिन्छु हैन सो त्यस्तो गरेर पनि सो यु क्यान युज भेरियस वेज टु वर्क आउट द होल ग्रुप टु show good kind of behavior or the behavior that you want. Okay. So, एउटा important कुरा आयो setting limits भनेर. Setting limits भनेको चाहिँ के हो? When there is a problem, we are helping the children to say कि त्यो कुरा चाहिँ राम्रो हैन नगर्नु भनेको नि खासमा हैन. So त्यो चाहिँ के हो भन्दा तपाईहरुले कस्तो पाराले भन्नुहुने. So उलाई पढ भन्दा पढेन भने या के भन्छ मुख धुनु भन्दा धुएन पनि I see you are के भन्छ not ready to wash your face ल तिमी 2 मिनेट बस and then let's try again. So it is also letting the child know that okay you are understanding that they have a problem with doing that but you want them to do it okay that they have to do it तर लु तिमीलाई सानो ब्रेक दिएर come I will let's do it together or I'll help you with doing this okay अन्त त्यहाँदेखि एउटा if they cannot comply use a natural consequence okay so suppose तपाईले मुख धुएन भने लुगाहरु सबै हातहरु सबै मैला मुख सबै मैला हुन्छ हैन मैला भएको मन पर्छ भनेर और अब चीजहरु बताबंगै छ उले टेबल क्लीन गरेन भने ओके सो सिन्स तिमीलाई यो के भन्छ क्लीन गर्नुमा प्रब्लम भयो सो अब we will take 10 more minutes to clean this table that means 10 minutes तिमीले टिभी हेर्नु पाएन या तिमीले कम्प्युटर चलाउनु पाएन if this child likes using computer so that there is a natural but a negative consequence to not doing the activity that you want them to do बुझ्नु भएछ तपाईले चाहेको चीज गर्नु भएन भने चाहिँ उले चाहेको चीजमा चाहिँ बाधा पर्छ भनेर चाहिँ एउटा नेचुरल कन्सिक्वेन्स नै खोज्यो भने हैन कि म पिट्छु हैन म यो गर्छु यो तिमीलाई भोलि जानु दिनु हैन तर अहिले एकछिनमा नै तिमीले जुन चाहिँ कुरा गर्नु मन परेको त्यसमा चाहिँ तिमीले नै कम्ती टाइम पाउँछ भनेर चाहिँ त्यस्तो पाराले एउटा लिमिट सेट गर्नु पर्यो अब टाइम आउट भनेको चाहिँ के हो भन्दाखेरि a lot of times it's usually used in the west हैन this concept is not so common in the Indian setting हैन टाइम आउट भनेको चाहिँ के हो अब एकदमै नानीले अग्रेसिभ बिहेभियर देखाएर या नचाहिँदो बिहेभियर देखायो भने चाहिँ उनीहरुले चाहिँ टाइम आउट भनेपछि चाहिँ कुनामा लगेर नानीलाई until the नानी becomes quiet क्या त्यहाँ राख्दिन्छ उनीहरुलाई नानीले जेसुकै गर्यो भने पनि तर अब त्यो गर्दाखेरि चाहिँ अब के हुन्छ नानीलाई चाहिँ त्यो सिचुएसनबाट हटाएर चाहिँ एउटा ठाउँमा राखेको नि त अब ट्रमेटिक नानीहरुलाई चाहिँ डेन्जर के छ भन्दा पहिला नै उनीहरुलाई लाग्न सक्छ कि हैन कि कोले पनि मलाई यादै गर्दैन मलाई मायै गर्दैन भनेर एउटा उनीहरुको मनमा बसेको हुन सक्छ सो यो टाइम आउट हामीले चाहिँ अब ट्रमेटिक चिल्ड्रनमा युज गर्यो भने चाहिँ के हुन्छ इट माइट एक्चुअली इन्क्रिज द प्रब्लम बिकज चिल्ड्रन विल फिल कि ए मैले यो गरे उले मलाई माया नगरेर चाहिँ मलाई अब मेरो याद अरूहरुलाई माया गरे मलाई नगरेर चाहिँ कुनामा राखेको भनेर सो इन्स्टेड अफ टाइम आउट वी क्यान व्हाट वी क्यान डु समथिङ इज यूज समथिङ नोन एज टाइम इन ओके सो व्हाट वी क्यान डु इज जुन चाहिँ एक्टिभिटी उले गर्नु मानेको छैन या हैन बताबुङ्गै पार्दैछ या के हो सो bring the child with you close to the activity with other children who are supposed to be doing the activity हैन उनीहरुले गर्दै छ राम्रो गर्दै गरेको को छाउमा चाहिँ गएर तपाई पनि त्यो नानी लगेर जानुस् र लु हामी सबै मिलेर अब यो गरौँ हैन अनि कामली क्वाइटली बोल्नुस् कि यस्तो कस्तो पाराले गर्ने र जब अरु नानीहरुले पनि कोअपरेट गरेर राम्रो गरेर गर्दै छ भने कस्तो हुन्छ र अरु नानीहरुले पनि आउ त जसले चाहिँ राम्रो गरेर गर्छ नि उलाई अब आउ त स्नेहा यसो तिमीले त कस्तो राम्रो गर्दैछ अब यसो उ र हामी मिलेर लु गरौँ त भनेर चाहिँ तपाईले एउटा पार्टिसिपेटरी एउटा एक्टिभिटी जस्तो बनाएर तपाईले गर्न सक्नुहुन्छ and you can ask older children also or children who are able to do it to come and sit with you to complete their work हैन र जब केही डिस्ट्रप्सन हुन्छ या हैन अलिकति नटी एक्टिभिटी जस्तो तपाईले देख्नु भयो भने चाहिँ you can reframe it that त्यो गर्दाखेरि did you want some help तिमीले त्यो एक्टिभिटी गर्दा गर्दा नै तिमीले चिचाउन थाल्यो कराउन थाल्यो that means तिमीलाई यो एक्टिभिटी गर्नुमा के प्रब्लम छ तिमीलाई मेरो के सहायताको जरुरी छ या मेरो के अटेन्सनको जरुरी छ भनेर तपाईले रिफ्रेम गर्नु पर्यो कि मेबी यु नीडेड हेल्प दैट्स व्हाई त्यो गरेको तर अर्को पाली लु त्यसैले हेल्प चाहियो भने आएर मलाई बोलाउ न हैन त्यो मलाई बोलायो भने म हेल्प गर्दै हाल्छु नि भने नि उले सिक्छ कि कराउनु चिचाउनु हैन उले हेल्प गर्नु पर्यो भनेर चाहिँ सो यु आर शोइङ देम व्हाट बिहेभियर यु वान्ट so you're giving more attention on the behavior that you want and less attention on the negative behavior or the behavior you don't want okay so that will increase the good behavior or the behavior you want and it will decrease the behavior which you don't want okay so what are the other ways to maintain connection abo naniharule homework गर्दैछ या खेलिरहेको छ भने you can just go and give a light touch at मजा आउँदैछ है के भन्छ आज त पुरा हाँस्दै छ या सम वर्ड्स यु क्यान से कि मलाई तिमीहरुलाई यसो खेलेको देख्दा खुसी लाग्यो समथिङ you can say something so that they feel that you are invested in them and that some sort of connection is there okay and अब जबरजस्ती हैन तर जेन्टली हैन तर अब आज त्यो भन्यो भोलि भनेर अब भोलि न अब कन्सिस्टेन्ट चाहिँ हामीले हुनु पर्यो सो दैट हामीलाई पनि याद छ नि कि हैन कोले चाहिँ हामीलाई मन पराउँछ तपाईलाई कसरी थाहा हुन्छ कोले तपाईलाई मन पराउँछ भनेर जब जहिले पनि तपाई आउँदा कोले स्माइल गर्यो भने कि खुशी भएको देख्यो भने यु नो दैट समबडी लाइक्स यु हैन हो त्यस्तै तपाईहरुले चाहिँ अलिकति एउटा कन्सिस्टेन्ट एउटा अटेम्प्ट बनाउनु पर्यो कि ओके समबडी केयर्स फर मी भनेर अन्त आई कन्ट्याक्ट मेन्टेन गर्दाखेरि पनि यु क्यान बिल्ड कनेक्सन कतिजना नानीहरु बनाउन सक्दैन आई कन्ट्याक्ट र बिस्तारै हेर त मलाई भनेर हैन गरेर अन्त a lot of times traumatic children ले चाहिँ अब attention मै प्रब्लम हुन्छ त्यसले गर्दाखेरि उनीहरुको हामीले गर्दाखेरि उनीहरुले एकैचोटीमा नबुझ्ला त्यसले गर्दाखेरि हामीले चाहिँ कन्सिस्टेन्ट हुनु पर्यो र अरु केयरर्सहरुले पनि तपाईहरुले यो भन्नु भयो भने हैन सिकाउनु भयो भने अरूहरुले पनि यो गर्यो भने children will have that sense of support of your concern okay अर्को चाहिँ आयो अब हाम्रो consequences त पूरा गर्नु नै पर्यो हैन कतिजना नानीहरुले अब हामीले भन्छ पनिश नगर्नु हैन पिटेर पनिश गर्यो भने त नानीहरुले खेतर हुन्छ झन अटेरी हुन्छ भनेर सुन्नु भएको होला नि हैन अब जति पिट्दा अब त यसलाई के पनि हुँदैन भनेर सो इन्स्टेड नाउ वी नीड टु टक अबाउट व्हाट इज नोन एज कन्सिक्वेन्शियल पनिशमेन्ट ओके अब सपोज वन चाइल्ड हैज बीन हिटिङ सम अदर चाइल्ड हैन सो now after some time you go and when the child is hitting you remove the child from the other child make the child sit down and say ki when you are calm I want you to apologize हैन जेन लाइक तिमीले पिट्यौ त्यसकारण तिमीले चाहिँ उलाई सरी भन अनि उसको चीजहरु चाहिँ के भन्छ उसको किताबहरु मिलाउनु तिमीले उलाई हेल्प गर्नु पर्यो हैन दैट मीन्स उलाई सरी मात्रै हैन उलाई हेल्प पनि गर्नु पर्यो दैट मीन्स there is a consequence for your behavior which is of hitting the child okay so एउटा भन्नु पनि पर्यो र एउटा consequence पनि दिनु पर्यो okay instead of going out at recess I want you to stay with me and we will put all the books back on the shelves that you tipped on the floor अब यो नानीले चाहिँ बाङबुङ पारेछ so अरु बाहिर ब्रेक टाइममा जाँदाखेरि चाहिँ तिमी नगएर now you will sit with me and you will help me put back all the books that you have thrown on the floor okay so एउटा consequence एउटा हामीले सिकाउनु पर्यो अब गर्नु मानेन भने तपाईले फिजिकली नै यु क्यान से कि कम हेल्प मी, यो किताब पक्र, यो माथि यसो राख लु भनेर। ओके, सो एकैचोटी उले भनेन भने फिजिकली यु विल गो एन्ड यु विल से ओके कम, टेक द चाइल्ड्स ह्यान्ड, पुट द बुक इन हिज ह्यान्ड एन्ड देन यु विल पुट द बुक ब्याक अन द सेल्फ। बुझ्नु हुँदैछ? सो त्यो गर्यो भने चाहिँ त्यो नानीले बुझ्छ कि ए मैले के भन्छ यसो गर्यो भने चाहिँ आई ओन्ली विल ह्याभ टु पुट इट ब्याक अल्सो रहेछ। सो नेक्स्ट टाइम गर्यो भने फेरि यु विल डु द सेम थिङ सो द्याट अन्टिल द चाइल्ड लर्न्स। बिकज नाउ वी आर नट सेइङ डोन्ट डु इट, वी आर सेइङ इफ यु डु दिस दिस विल ह्यापन टु यु भन्दाखेरि सो द्याट बिकम्स मोर नेगेटिभ नि त, होइन? सो त्यसले गर्दाखेरि अब कसलाई चाहिँ फेरि टिपेर माथि राख्नु मन लाग्छ घरिघरि त्यो ब्रेक टाइममा नगएर, होइन? त्यसले गर्दाखेरि त्यो कारणले चाहिँ उहाँले सिक्छ। ओके, सो द अदर एक्जाम्पल इज चिल्ड्रन माइट युज ब्याड वर्ड्स, होइन? सो यु क्यान टेल कि सिइङ द्याट यु स्पेन्ड अ लट अफ टाइम स्वेरिङ दिस मर्निङ, होइन? अब्युज गर्दैछ बिहानदेखि। सो लु अब गएर हामी यहाँ किताबहरूमा खोलेर लाइब्रेरीमा हेरौँ कि वेन यु आर एङ्ग्री अर वेन यु आर अपसेट तपाईँले त्यो वर्डहरू युज नगरेर अरू के वर्डहरू तपाईँले युज गर्नु सक्नुहुन्छ, कम लेट अस लर्न द्याट भनेर चाहिँ। सो देयर इज अ कन्सिक्वेन्स टु डुइङ समथिङ विच इज अनवान्टेड। ओके, सो अर्को चाहिँ आयो के हो, अब कति नानीले एटेन्सन सिकिङ बिहेभियर पनि युज गर्छ। ओके, सो इट इज ट्रु द्याट दे आर एटेन्सन सिकिङ and usually because they have not got the attention, so they might, some children might be desperate for it, so they do things badmashi garcha so that you give them attention. Okay, because they have had so little positive attention in their lives, so if they are seeking attention you give it to them. Okay, so किनभने हामीले उनीहरूलाई एटेन्सन दिएन भने हैन के हुन्छ कि उनीहरूले यो ह्युमन कनेक्सनमा नै प्रब्लम हुन सक्छ बादमा, र they will find it more difficult to connect with any other person in के भन्छ their lives. So when they are doing something naughty, we will not focus on the naughty behavior, but we will say कि ए तिमीले यसो गर्यो के कुरा गर्नु छ के भन्नु छ, आउ बस त आउ बरु तिमी र म अलिकति टाइम स्पेन्ड गरौँ हैन भनेर। सो त्यो गरेपछि चाहिँ they will start to form more connections with you. So now यो चाहिँ तपाईको कसरी तपाईले कन्ट्रोलमा तपाईले कसरी नानीलाई कन्ट्रोल गर्ने, हैन? सो सपोज अ चाइल्ड इज डुइङ अ ब्याड बिहेभियर लाइक यु नो डजन्ट वान्ट टु वेयर द कोट, हैन? जाडो छ लुगा लाउनु मनै परेको छैन, या काम गर्दाखेरि हैन होमवर्क गर्दाखेरि यताउता हिँडिरहेको छ भने यु क्यान ट्राई टु स्ट्रक्चर द ब्याड बिहेभियर इन्टु समथिङ एल्स। ओके, बाई रिमेनिङ इन कन्ट्रोल। ओके, कसरी गर्ने तर त्यो सिचुएसनलाई चाहिँ अब साह्रै नेगेटिभ नबनाएर चाहिँ सो उसको केही चोइसै छैन तर दुईटा चोइस मात्रै छ बनाइदिनुपर्छ। ओके, त्यो काम गर्नै पर्ने, तर चोइस चाहिँ के हो, एउटा चोइस चाहिँ तिम्रो हो भनेर। जस्तो नि अब कोट लाउनु मानेकै छैन भने हैन, डु यु वान्ट टु वेयर योर कोट अर डु यु वान्ट टु क्यारी इट, सो द्याट इज त्यो दुईटा चोइसमा एउटा गर्नु पर्यो। होमवर्क गर्नु मानेको छैन भने यु क्यान फिनिश द्याट वर्क सिटिङ डाउन अर स्ट्यान्डिङ अप, oh, so that the child knows that you are the one in control. All right, and then you can finish that now or you can finish that in the break time. That means अब अहिले गर कि बरै गर तर सक्नु त पर्यो नि त्यो गरेर। ओके, तो अब लास्टमा केही सिप लागेन भने चाहिँ लास्ट चाहिँ एज अ ह्युमर युज गरेको हो कि तिमीले टोपी लगाएन भने म पो लाउनु पर्ने हो क्या हो भनेर। ओके, so you have to create that scenario where the children are responding to you, not you responding to the naughty behavior of the child always. So you have to make the situation that you are in charge of the relationship that is there. Okay, so yo gardakhari chai always remember that we all get angry, we all get frustrated because we are trying so hard, but we need to learn to modulate that and we need to keep that frustration or that anger, हैन? त्यो हामीले कुन चाहिँ टोनमा भन्दैछ, अपे हैन भन्दैछ कि आए त्यसो नगर है भन्दैछ। ओके, सो त्यसले गर्दाखेरि चाहिँ लर्न टु मोडुलेट योर भोइस कि त्यो नगरेर चाहिँ यो गर्नुपर्छ हैन भनेर। सो विदाउट लुकिङ थ्रेटफुल और इन्टिमिडेटिङ हामीले भन्नु पर्यो। ओके, एन्ड जब उहाँले राम्रो काम गर्दैछ, तपाईले मन परेको काम गर्दैछ भने चाहिँ त्यसमा चाहिँ हामीले शाबासी दिनु पर्यो, किनभने त्यो शाबासीको लागि नै नानीहरूले झन् राम्रो बेहोरा गर्छ। Okay, so comment on actions so that the children can feel good about something they have done, rather than have to think about whether they are not good or bad. Okay, so त्यसले गर्दाखेरि I see you made a good choice and finished your work before recess. Off you go to play now. उनीहरूलाई नै हामीले तिमीले राम्रो गरेछ भनेर चाहिँ एउटा कस्तो पाराले भन्ने हेर त तिमीले राम्रो गरेछ अघि मैले भने नि काम अहिले गर्ने कि भरे अहिले नै गर्यो अब हेर त खेल्नु टाइम ज्यादा पायो हैन लु जाऊ अब गएर खेल हो मैले देखे नि तिमीलाई रिस उठ्दै गर्दा हिकाउनु मन लाग्दा तिमीले उसँग झगडा परेन हैन त्यो सारो चाहिँ पर्यो तर तिमीले के भन्छ राम्रो डिसिजन लियो मलाई पुरा खुसी लाग्यो हैन तिमीले झगडा परेन भन्दाखेरि मैले झगडा नपर्दा मैले रिस कन्ट्रोल गर्दाखेरि चाहिँ मैले प्रेज पाए भनेर देन दे विल लर्न कि हाउ टु रेगुलेट देयर इमोसन अन्त गरेन भने पनि प्लेग्राउन्डमा राम्रो गरेर आज खेल्यौ हो तिमीले के भन्छ मजा लाग्यो तिमीलाई यसो हेर्नु भन्दा दे विल वान्ट टु इन्भेस्ट मोर इन प्लेइङ अर मिलेर खेल्यौ आज तिमीले मलाई कस्तो खुसी लाग्यो सबैलाई बोलाएर नखेलेकोहरूलाई पनि बोलाउँदै के भन्छ ग्रुप एक्टिभिटी बनायौ तिमीले भन्दाखेरि अरूहरूलाई पनि झन् ग्रुपमा ल्याउने उहाँले कोसिस गर्छ अन्त मिलेर यु आर एबल टु रियली कोअपरेट इन द्याट ग्रुप एन्ड आई सॉ यु बिङ रियली काइन्ड टु सारा व्हेन शी हर्ट herself उ लड्दाखेरि तिमीले हेल्प गर्दाखेरि तिमीले यसो गर्दाखेरि कस्तो के भन्छ तिमीले राम्रो के भन्छ व्यवहार गर्यौ मलाई एकदमै के भन्छ तिमीले राम्रो व्यवहार गरेको जस्तो लाग्यो भनेर तपाईले भन्नुभयो भने दे विल सो द मेन पोइन्ट इज द्याट we need to praise children for things that they are doing well so that they also have a good view of themselves and they will do that activity झन् बेसी गरेर okay so environment चाहिँ हामीले त्यही हो अब this is the last slide that is there I think we have just reached the time limit also so हामीले environment चाहिँ safe एउटा create गर्नु पर्यो structured बनाउनु पर्यो predictable र हामीले जे कुरा गर्ने चाहिँ एउटा consistent पाराले हामीले गर्नु पर्यो okay so hope this has been helpful to all of you so now this is the end of the presentation so if you have any questions or anything now we'll be open to taking that है because अब यो टपिक नै मैले भनिहाले हैन एकदमै ठुलो थियो so couldn't make it अब I tried to make it as simple as well as hopefully helpful to you all so hopefully I have succeeded in that हर्कजित राई के भन्नु छ तपाईलाई तपाईको माइक अन रहेछ नि So please give me some feedback हैन so that
यसको चाहिँ मेसेज लेख्ने हुँदैन
Having come to the end of the first session, I now request Learning Director Sikkim Judicial Academy to kindly offer the vote of thanks.
Yes, so now we have come to the end of first session of today's program. So it is my honor and privilege to conclude the same by extending vote of thanks to all present here, especially the learning resource persons who has taken painstaking efforts for this untiring deliberation for more than 2.5 hours. And in this occasion, it is my unique privilege to extend sincere gratitude to learned resource person for sparing precious time with all of us here by sharing our valuable knowledge and expressing eminent views on topics of today's program. I would like to once again offer sincere thanks to Madam Dr. Sonam Ongmu Lasopa, Senior Clinical Psychologist, STNM Hospital, once again, and it is equally privileged to extend my sincere thanks to all participants who, keeping aside once again all personal comfort and convenience, participated in the first session of today's program wholeheartedly without hesitation and made the entire program very vibrant and great success. Thank you all. Now, with the consent of Dr. Sonam Ongmu Lasopa, I declare the end of first session. Now, I would like to welcome Dr. Bipasha, child right activist, social worker, West Bengal, for the second session of today's program on the topic addressing mental health in the juvenile justice system that covers both CP and CCL, children with special reference to the mental health intervention in the child care institution. Welcome you, madam.
Thank you, sir.
Yes.
And a very, very good afternoon to all of you.
Yes.
Thank you so much. I would start my session with a disclaimer that I am neither a child psychologist or a psychiatrist, but yes, I have my experiences with children, working with them. I've learned, and because of the topic that you have given, I started reading up a lot on art therapy, on play therapy, okay, on the initial topic. So I would be throwing some light on that also. So with your kind permission, I would like to start the PPT also. Thank you so much. I'll just switch off my video and I'll start the PPT. Thank you.
Yes, please kindly proceed, madam. Thank you so much.
Can you see the PPT?
Yes, ma'am.
Okay. Thankfully, yes. Okay. So I'd be taking addressing mental health in the juvenile justice system. So I would start with the basic difference between CNCP and CACL, child in need of care and protection, and child alleged to be in conflict with law. So I would, in outset, I'd like to ask the participants. We have counselors, we have members of DCPU unit, and we have the person in charge of the CCIs. Am I right in saying this? Are these the participants?
Yeah.
Okay. Thank you. So this is nothing new to you. So I'm just reiterating, it's type of revision. So the CNCP has included those who are helpless, decided with abusive parents, guardian elders, incapacitated guardian parents, abandoned, surrendered, missing, runaway children, victim of natural man-made calamities, abuse, exploitation, mentally ill, physically, mentally challenged, suffering from terminal illness, abused for immoral gains, vulnerable to drug abuse, trafficking, and what I put in italics has been added in 2022 Central Model Juvenile Justice Rules. I think you are aware of that from 1st September. We have the Central Model Juvenile Justice Rule 2022. So following that, I've added this: who does not have parents, that means the orphans, and no one is willing to take care of and protect, or who is abandoned or surrendered. This has been added newly. Then who has been or is being or is likely to be. These three things has been added also in 2022 rules. To be is likely to be abused, tortured or exploited for the purpose of sexual abuse or illegal acts. So a child who has been or is being or likely to be. So this is matching POCSO also. If you read POCSO also, in POCSO also exactly the same thing is given. Has been, is been, likely to be abused. Okay. So it is matching to our topic also. So child labor, street children, found begging, who is in risk of marriage before attaining age of marriage. So these children may be affected by trauma, abuse, and neglect. Right? You agree with me? Now, these children also can, for some reason or the other, keeping this in the background, might come in conflict with law, right? So we call them alleged or found to be to have committed an offence or have not completed 18 years of age. As on from my experience, and you would also agree from your experience, that all CACL children, all CCL children, they are some way or the other are CNCPs, right? So we would be addressing CNCP mentally traumatized children and CACL also. What is the mental makeup of these two categories of children? Now let us get into CNCP category. So when a child gets abused, what do you tell them? Do we call them a survivor or a victim? Let's see. The term survivor recognizes that the person has the agency, and she or he and others, or others also, we see the third gender also nowadays, is capable of taking decisions despite being victimized, humiliated, and traumatized due to the assault. So we always try and call the person who has been abused for whatever reason. It might be sexual abuse, it might be mental abuse, it might be physical abuse, or all the three, any sort of abuse, who is traumatized, we call them survivors. Okay, so that they have an agency. That means they can participate, they have right to be heard. What they are saying also, we are listening to what they are saying. Okay, so their agency is being maintained. Use the term survivor by all those providing services, recognizes these efforts and encourages them to believe the person and not to pity him or her or others. Okay, we empathize with them, we don't sympathize with them. Whereas the term victim is understood as a person who doesn't possess agency and is not fully capable of comprehending situation at hand because of victimhood faced. Okay, given the judgmental attitudes towards the issue of rape and sexual assault, often police, health system, and other stakeholders, what we try to do, we make decisions on behalf of the child, of the person, because there's a belief that the person is so victimized that that person may not be in a frame of mind to take decisions independently. That's what we think. To an extent, it might be true, but for that time period. But once you start counseling the child, once you start hand-holding the child, once you allow space to the child starts speaking in whatever way the child can. That is where the art therapy, the play therapy, all these therapies come in. Okay. Now let's get into POCSO and GJ Act with regards to survivors. Let's see. Probable psychological risk that these children who are victims of sexual abuse and exploitation or otherwise traumatized children, they are always, usually, not always, usually they are in majority of cases, their secondary victimization, happens to the survivors. Now, what is secondary victimization? It occurs when the victim suffers further harm, not as a direct result of criminal act, but due to the manner in which institutions and other individuals treat with the victim. It is because of that. Something happens, the child suffers, and then gets into the system, our juvenile justice system or the judicial system, and further harm happens to them. Okay. Now, secondary victimization, in its simplest sense, means behavior of individuals or the society towards any particular person who has been a victim of any victim is over a survivor of any offense or wrong committed to them, and that behavior is of victim blaming rather than victim support. Now, when this becomes institutionalized, it becomes an institutionalized secondary victimization and is most clearly visible within the criminal justice system of our country. That is the reason initially I asked who are the participants, because these three groups of participants that is today attending this program, three of you are the caregivers, the stakeholders, the handholders of these traumatized children. Secondary victimization results in complete denial of the rights of the victims, which they are supposed to be provided, and such violation of rights is intentional in nature. Now, now I'm getting into sexual abuse. Sexual abuse of children remains cloaked, masked in shame, in guilt, in family honor, and for children, it is even more difficult to speak out and share, as few have vocabulary to describe what has happened to them. This I had spoken earlier also in Sikkim, I do remember. It is very difficult. Over here, I was reading up, yes, the art therapy, the play therapy plays a very, very big role, you know. So I'll come to that. I wouldn't be able to explain to you what means. I'll be telling you how it helps, but the technicalities of art therapy and the process, I wouldn't be able to tell you that. That some trained personnel has to come and talk to you about it. So more often than not, the abuser is a known person whom the child trusts and even uses and even loves, and hence the incident which will seldom get reported in time. This is the reason. So secondary victimization by police, medical professionals, presiding officer, PP, and other agencies. I'll be coming to this line one by one. Let's get into the police. So now, usually what happens in POXO and also in the JJ rule, it's given where should the recording of statement take place. Yes. Yes. Any problem? Yeah, tell me, any problem? Should I continue? Hello?
Yes, ma'am.
Yeah, any problem? Should I continue?
Yes, ma'am. Yes, ma'am.
Yes,
Okay,
ma'am.
I thought you couldn't hear me. That's why. Okay, fine. So, where should the recording of statement take place? It should take place. All of you know it. I'm reiterating. In POXO, also in JJ rules, it is given residence of the child, or where the child usually resides, or at the place of child's choice. Child cannot be detained in the police station in the night. By whom it should be taken? By a woman police officer. In majority of cases, if it is possible, is written, or in any woman officer of the IPC for the IPC offences. Officer should not be in uniform. Officer should not be below the rank of sub-inspector. Now, what happens in practicality? If there is no woman police officer to record the statement, there is a male officer. A lady should be accompanying that officer when the recording is taking place. Any lady, right? How? Statement to be recorded in the presence of parent or person whom the child trusts, and and it should be read out loudly to them. So this is very important. If these things do not happen, the child is already traumatized. So to allow the child space, to allow the child to actually come out with what happened, so that you can write the complaint in a proper manner, so that a formal FIR can be lodged, so that the contents of the FIR is I would say it would make sense as evidence when the child goes to depose in as a witness, when the trial takes place. So these things has to be kept in mind. The statement should be recorded by audio-visual means if possible, and in simple language as the child says. Otherwise, the child gets doubly traumatized. In the court of law, when the child goes to depose, then the PP, in this difficult language, the FIR has been lodged, okay, the complaint has been lodged, that is read out to the child. That child is completely flummoxed. The child doesn't know what's going on. And then again, the entire thing is made to be repeated. Do you understand? Everything has link to the traumatization of the child. So what all we can do to de-traumatize the child, to see to it the child doesn't get traumatized again. The assistance of qualified translator or interpreter can be sought if you have a problem that the DCP unit would be providing you with the panel. Provide a copy of the statement to the child and the family and inform through Form A and preliminary assessment through Form B. That is, Form A is the services and the information that should be given to the parent, to the guardian, to the child by the police when a POXA case happens, okay, to the survivor. And then PA is the preliminary assessment that has to be filled up, this form, and has to be given on the first production to the CWC, Child Welfare Committee. I'm not getting into the details, but that helps in arresting or addressing traumatization of a child. Now, protective measures. Officer investigating the case must ensure that the child does not come in contact with the accused at any point of time. Identification of the child must be protected from the media unless special court orders otherwise. And the child with a disability, a deaf and dumb child, a child who cannot, maybe has epilepsy, or a child, so epilepsy is not a disability anymore, but still, a child who is not able to walk, a child who's mentally retarded, or maybe mentally ill. So a lot of things would be there. So the assistance of a qualified special educator or a person familiar with the manner of communication of the child or an expert in that field can be sought while recording the statement of a child with mental or physical disability. This is very, very important. Otherwise, a conviction will not happen. Otherwise, the child, remember this, the child might be deaf and dumb, the child might be blind, but the child's senses is intact. The child feels the pain. If a sexual assault has happened, the child feels the pain. The pain is always there. So we have to address the pain of the child, the trauma of the child has to be addressed. Remember that. So these things has to fall into place. Now, how would the rights of the child be ensured in the police station? You see this thing, picture is double way. One is there's a ban on the lip of the child that cannot speak, that's not allowed to speak. The other is this megaphone on the hand where she is allowed to speak. Take the consent of the child when the child is speaking on the camera or recording. No child shall be detained in the police station. That I have already said that, and they should not come in any point of time contact with the accused, and the child should be protected in the public media. Explain in brief the next steps that follow post the recording of the statement. That is very important. Usually, I've spoken to the survivors. Majority of them, why would I say majority? All of them that I've spoken to till date, they've said, we do not know what is happening to us. We have been taken to the police station, questions were asked, some recordings were done, and then another date came. We went to the court, we had to depose, we had to repeat. Then there was a test identification parade sometimes. We had to touch and identify the child. Medical examination was taken. We were examined. Nothing was explained to us. The accused, is out on bail, roaming around, threatening us. All these things I had to hear. So we have to take care of them. So what is the reality check? In majority of cases, recording is done in police station. Is the recording of statement always done by lady police officer? This is my question to you. Is the child asked as to whom he or she others prefer to stay with while recording is done? Do we ask them? Usually it is a very formal question and answer session. Okay. Usually statements are framed in phrases that is tough for any child to comprehend. Very, very tough language is used. It is not a simple language that the child understands and as spoken by the child. In most cases, after the statement is recorded, it is not read out loudly to the child, neither to the parents, nor to the guardians, because if corrections were to be made, it could be made immediately. Are the police officers recording the statement in civil clothes? I think yes. This answer would be yes. Is the child made to feel comfortable and at ease before recording the statement? Before I am talking about, not even during, before. Are the police officers aware of the fact that these children should be accorded frequent breaks in between recording? because it's a very traumatic thing that they are saying. Give them the space, give them the time, let them have some water, let them sit around and maybe play with something or maybe talk of something else. How do they record the statement of a child with mental or physical disability? Do they have the list of experts ready? Do the police stations have? Is the DCPU unit have readily available these things and distributed to all the hospitals, all the one-stop centers, all the police stations, all the CWCs, all the JJBs, all the sessions court, children's court? Are they being distributed? This is very, very important, this area. Children are made to wait for hours before the statement gets recorded. This is what I get to hear sometimes. In some cases, the victim and the accused are not segregated. Extremely traumatic for the child. Do the police take the consent of the child to speak on camera or while recording? This is also important. There are cases where the identity of the child gets disclosed before the public media. This is extremely traumatic for the child. The police is yet to ensure informed participation of the victim or the survivor that I'm talking about, where they explain each step and also explain in brief the next step that follows post the recording of the statement of the child. In some cases, police cite jurisdictional issue and do not register FIR. This is very unfortunate because we have a thing known as zero FIR. We must be aware of this because anything that happens anywhere in the country, immediately in that police station it gets registered. In your state, in other state, and then wherever the child is placed, where the child goes, place of residence, the child goes there, then this particular FIR, the contents of the FIR, the case gets transferred there. It's very simple. Read it up. Zero FIR. That should be happening. So these are my recommendations that we should have well-trained police officials. They inform the child and the parents, availability of the services, including counseling, assist them in contacting the person. That means your number, whoever is out here, the counselors out here, these numbers should be in your police station of your jurisdiction. It should be there. The right of the child to legal advice and counsel. So even if it is not, the government counselors, we have NGO counselors also. If they are certified, they have to, mind you, certified counselors. It has to be vetted by the DCPU and should go through, if possible, go through your Department of Women and Child Development. With their concurrence, I think you should draw up a list of counselors in all the district and give the numbers to all concerned. Right to child to legal advice and counsel. This is very important. Is there in the section 40 of the Act. Then POCSO rule says that HGPU or the local police shall also inform the child and parents about the entitlements and services. That's what I was talking about in Form A. And I was talking about zero FIR. Now, I'm coming to support person. That should be given by the Child Welfare Committee when a POCSO case happens, with the consent of the family and the child, if they want one. Now the thing is, if they do not know about the support person, how will they ask for a support person? So the police initially talks about the support person, the counselor can talk about the support person, DCPU can talk about the support person. If the child goes to the CCI, the caregiver, the person in charge can tell them about the support person that the child should be getting if they ask for it. Okay, so I feel that before they ask for it, they should know about it. So the task of providing support person to the survivor and her family, his or her and others' family, by the CWC becomes essential as they assist a child during the legal procedure, access compensation, and enable the healing process. So when last time I had come to Sikkim, they had said a list of support person has already been given by the DCPU to all concerned. If not, there is still time, please do it. Please draw up the list in all the districts, and this panel should be readily given to all the CWCs. Support person can play a critical role in addressing concerns, fears and doubts that children and their families face, giving support to navigate through this difficult juncture. The support person becomes a vital liaison between stakeholders and the family and the child by assisting them through various stages of the case, starting from the lodging of the registering the FIR, medical examination, counseling process, going to the court to depose till the end. Okay, so and follow up also after that, because it doesn't end in a day, because this counseling, this therapy does not happen. It's not a one-time thing. It is a long process. When a child gets traumatized, a child gets, sexually abused, physically abused, mentally abused. This is a long drawn process, this therapy. You cannot treat them in a single day. We know something as post-operative follow-up, right? That takes months, that takes years. Same thing happens out here also. The support person is in touch with the public prosecutor in the case and work with them to ensure that the court proceedings go smoothly. So building rapport with the child, building the trust and confidence of the child and the family, interacting with them. Remember, the abuser has broken the trust of the child, because usually the abuser is known to the child. Thus, it is going to take a while for the child to trust another adult who is potentially a stranger. So you are a support person, you're a stranger to the child, right? You are a PP, you are a stranger to the child. You are a counselor, you're a stranger to the child. All of you are strangers. The police personnel who's taking the deposition, the statement, 164 statement recorded by the minister, all of you are strangers to the child. So think about the child. A known person has abused the child. So how can a child in an hour or in a day start trusting a stranger? Think in those terms. So it takes time. That is why repeatedly I'm telling you, empathize with the child. Try to understand the what has happened from the angle of the child's point of view. Now, usually what happens, the support of the support person might not be available to the survivor and the family. Police, CWC fail to inform the victim and the family about this provision. This is very important. Now that you are here, all of you are here, you know about the support person. If something like this happens, please tell them to go to CWC and ask for it. Ring up the CWC and tell them to give the support person if there's a need. There's not a need, but if there's a need, please provide it. Non-formation of panel of support person by DCPU and providing the list. This is the reality check. Lack of well-informed and trained support person. They should be trained. Sometimes without the necessary assistance of support person, survivors and the family, they face tremendous problem in every stage of the judicial process, and the survivor invariably becomes the victim of secondary victimization. Now the TI parade. This is again a reality check. This is from my experience. I'm talking to the survivors. There are cases where the victim is made to touch and identify the accused in the court. Most of the courts and the correctional homes do not have the requisite facilities for conducting a TI parade. Now that you have a correctional CCIs are out here, it might so happen that in an observation home there is a child alleged to be in conflict with law, whose TI parade the police wants. They have given a request to the principal magistrate that we want a TI parade in the observation home. It is a double-edged sword I'm talking about, because in out here, most of our principal magistrates say no. We say no because think about the CACL. Maybe the child has been kept out there in observation home. The other children doesn't know what for what offense the child is out here. What alleged offense the child is out here. The child is happily staying out there, right? Suddenly, the child is made to stand with others, and then somebody else comes, and then somebody else points out. Then everybody knows it's a POCSO offender. That child gets stigmatized, and think of the survivor going into a boys' home amongst others. That child has to point out in front of others. It is a double-edged sword. So think twice before doing all these things. There are ample chances of the survivor's secondary victimization due to this gap. So, Madras High Court, Honorable Justice Indira Banerjee, she said that to conduct the procedure in an appropriate manner, special rooms, it can be in correctional home or in any other home for that matter, special room to conduct the TI parade in all prisons. She has talked about prisons, but we can go a little ahead and say in CCIs also in the state shall be made. Such rooms shall have one-sided view glass separating those lined up for parade on one hand and the witness and the magistrate on the other. Witness and magistrate should not be visible to those who are lined up. Now, this I would request only in correctional home. For CACL, I think you can do this. You can give photographs, like on 7th September 2021 in state of Maharashtra. It is the High Court, the Honorable High Court of Bombay. They said that the learned prosecutor showed photographs. From photographs, the child should, who this thing is, the offender is. That can be done. So why do you need to do a TI parade? And I'm not getting into the extent because our Supreme Court has said the TI parade is not required for all cases. Clearly they have said in which all cases it is required, how it should be done, the 12 this thing has been given. It is important to inform the child and their parents or guardian that they will be present, the child or the guardian, that the guardians can be present while the TI parade is taking place. But they cannot prompt the child while the TI parade is underway. They can be present. The support person, if there's a need, can be present, but they cannot prompt the child. Okay, the support person can intervene and recommend stopping the process if the child is asked to touch the accused or show the accused or face the accused. So that is why it is so important, this part. Now I'm getting into the medical part. Experience of the child and the family when the medical legal procedures take place. Child and the family, they are completely in dark about what the medical examination is conducted for. This is completely true. Neither the police nor the examining doctor they explain. Police cannot explain, but the examining doctor can explain. Police can at least say, means this is what the police should not be explaining actually. Police should only explain that why you have been taken out there. What is the reason? Let the doctor explain. Long wait to be attended to in district hospital. That's what I get to hear, that they are made to sit there for hours together. Medical examination extended to 2 to 3 days, sometimes when blood tests, medical examination and scans have to be done. Extremely traumatic for the child. The examination is conducted in a manner which does not respect the dignity of the child. Lack of private space for history taking or examination. Many times is done in the emergency casualty or labor wards. This is done. Is this correct? To a child who is already traumatized, already exploited? Consent not explained or taken in many instances. Consent has to be taken if the child is above 12 years old. And below 12 years old, the parents or the guardian will give the consent. It has to be a written consent. Samples and swabs collected despite extended time lapse since assault incident. There is no need, but still samples and swabs are collected. Inability, indifference to connect, develop rapport with the child, leading to very superficial history. So this is a very important area. The medical personnel who are examining the child, the nurses in attendance or the attendants, the lady attendants in the medical facility should be aware, should be alert, should be oriented, should be trained in this area. And we also should be trained in this area. If we see things are going wrong, we can intervene immediately. We can tell them the POXO Act says so, JJ rules says so, POXO rules says so. So you are going beyond the act, right? Male doctors examining children even when child expresses her discomfort. Now, lapses by doctors, pregnancy of minor girls, very important area. Internal examinations conducted even when the child is in a lot of pain. Sample swabs routinely collected despite history and examination clearly indicated that appreciative sexual assault has not occurred. It might be a stalking thing. POXO covers a wide range of sexual harassment also. It's not a penetrative sexual assault. It's just a sexual harassment. It is just a sexual assault. It's not a penetrative sexual assault. There's no need of doing this internal examination. Almost never considering the use of lubricants while being the cause of no injuries. Usually, what happens in doctor is they see there's no injuries, but it is a penetrative or an aggravated penetrative sexual assault because maybe the perpetrator has used lubricants. So they write there, no this thing. They write over there that nothing has occurred, no offense has occurred. Almost never using then almost never testing for alcohol or drugs, even when the child does not have any memory or recollection of what happened. We have party drugs, all of us know about it, but clearly the assault has occurred. Chain of custody of samples and materials sent to FSL are not maintained. This is again a very technical thing. I would not get into this. We still have doctors in few districts demanding court orders for termination of pregnancy below 20 weeks. They do not know about the newly amended MTP Act 2021. They have no idea about it. Doctors are deciding for the child if pregnancy should be terminated or continued. Doctors decide. Family caregiver support persons of the child who is having a termination or police asked to bring containers or to pack the product of conception. This the hospital should be providing. Where will the family get it from? Where is the police getting it from? And the entire product of conception sent to FSL for testing is no need to be sent. It's a big thing, isn't it? The fetus might be a big thing. A small tissue will it's good enough. While just a small tissue can be packed and sent for DNA sampling. This they do not know or they don't want to do it. Okay, I'll just quickly get into this because it is just for knowledge sake and nothing else. That Rule 6 talks about a POXO rule. Rule 6 it talks about 2020 amended POXO rule that 6-7. If the child is found to be pregnant, then the registered medical practitioner shall counsel the child, number one, how to the child, her parents, or guardians or support person regarding the various lawful options available to the child as the MTP pregnancy 71 has been amended. Okay, they have to tell them that it has been amended. It's 2021. What is it? So termination due to failure of contraceptive methods or device. Now let us get into it. Under the Act, a pregnancy may be terminated up to 20 weeks by a married woman in case of failure of contraceptive method or device. Fine. It allows unmarried women to also terminate a pregnancy for this reason. Okay. Opinion needed for termination of pregnancy. If it is 20 weeks of gestation, then it is only opinion of one registered medical practitioner, RMP. 20 to 24 weeks, it is two RMPs. If it is beyond 24 weeks, and in case of substantial fetal abnormalities, then a state level medical board. Now, see, upper gestation limit for special categories. Listen to this very carefully. Increases the upper gestation limit of 20 to 24 weeks for special categories of women, including survivors of rape, victims of incest, and others vulnerable women, differently able women, minors, among others. So children have got into this. So you did not go to the court to get a court order, and confidentially has to be maintained. The name and other particulars of woman whose pregnancy has been terminated shall not be revealed. Abortion to be performed by doctors and not by coax. Remember this. The Act requires abortion to be performed only by doctors with specialization in gynecology and obstetrics. Okay. The mental health intervention, if you see continually, the trauma of survivors is usually not addressed, but a perfectionary medical examination is concerned. They do not advise. They do not give advice about the mental status of the child. It is only the physical thing that they look into. But no, the examining doctor is aware of the mental status of the child. Even if they are aware, the intervention is required. They neither advise it nor do they facilitate. Now that you know, please make them aware of it. See to it, it happens. The examining doctor is neither trained nor aware of the critical areas of mental health intervention with the survivor of a CSA, child sexual abuse case. Lack of mental health intervention sometimes leads to secondary victimization. Medico-forensic procedures usually do not follow the new Ministry of Health Family Welfare Guidelines 2015. You can tell them, are you following the guidelines? Are you following the NCPCR guidelines? Are you following the Ministry of Health and Family Welfare guidelines? You can keep it yourself if you want to. Download it, go through it, so that you can point out. The examination is still not conducted with the informed consent of the victim. Internal examination victim continue. They are not informed of their purpose. In majority cases, they do not have any idea about the examination process and why it is necessary to do. It is a must, I'm telling you. The guidelines are there, and it's the statutory guidelines are also there. Now, I have come across survivors who are telling me that medical students were present during examination, and she was like a guinea pig. They were showing, the doctor was showing, see, this is the extent of the damage that has been done, and she was just like a body lying there. Medical examination neglects treatment and counseling. The medical procedures emphasize only on the process that are relevant for the collection of evidence to feed into the trial. That is the extent that they go to. They neglect granting continued medical attention to the child for treatment of injuries incurred during assault and counseling. Sometimes what happens, this child might have been trafficked also. So a POXO case might be a trafficking case also. So over there, they are injected hormonal injections and hormonal these things. So to get out of that, it's a prolonged thing. They might be HIV infected. They might be having STD. So all this is a prolonged treatment. So they do not talk about it at all. So think of the trauma, think of the harassment, mental and physical both. So the reality check is this, that they usually what happens, like this horrible judgmental microscope they put into. Indrajit Khandekar has spoken about this. So the provision to provide alternative clothing. This is another very important area. The child is taken out there. Then in Sikkim when I had come last, I had asked them. So what do you do? Because you are taking their undergarments, for the stains and all, you're taking it for your MLC purposes. So what do you give them? Man, we give them a medical gown. I said, how do they go home wearing a medical gown? So who makes the provision? The child, the parents, do they know about it? Are they in a mental frame? Think of the trauma the child goes through. Medical gown and going home. She's told to open everything and give away. These provision has to be made. We have to know about it. We have to decide as to who is going to take this provision. Is it the hospital, DCPO, CCI from where the child goes? Who? The support person, the CWC. Who does it? So we have to put our heads together and decide. As per the guidance while carrying out the medical test, no third person must be present out there. It's not followed everywhere. Like I was talking about, the psychological effect should be recognized and the patient should be provided counseling, social support and appropriate reference. Doctors cannot use the word rape in their opinion that they give, in the report that they give. It's a legal definition. They can at best write exactly what has happened to the child and the case history of the child. Little bit. They have to follow the guidelines of POCSO and accordingly and the CRPC, and they have to write, not a medical diagnosis. We have found documents where doctors have written in their report that the victim has been raped. Okay? I had spoken about all of it. I'm not getting into this again. These are the recommendations. Rarely the caregivers, stakeholders raise concern about mental trauma and anguish survivors go through due to the delay in the receiving service. Okay? Do not raise the concerns. CWC officer in charge of CCI, support person, medical professionals, none of you are aware. Maybe I'm wrong, and I'll be presently wrong if I know that you know about the MTP Amended Act 2021. All stakeholders, including CWC, to have knowledge of relevant section of the MTP and its correct and timely implementation. Need to create more awareness about the right to healthcare. Right to healthcare for rape. We won't use the word rape out here. Sexually abused survivors and the family. Right to healthcare. Medical counsel, and I'm talking about family. Talking about the counseling of the family. We are dealing with it's a horrific case that we are dealing with in Bengal now, where the parents need counseling also. They have adopted a child and the child has gone through terrible experience in the star that she was kept. So even the parents need counseling. So it is not only the child, it is the family. Remember that. Medical counsel to take strict action against doctors denying treatment of survivors as mandated in the Act. We also have cases where the fathers do it, right? Fathers are maybe behind the bar. The child is with the mother. The mother is not forgiving the child for speaking the truth and sending the earning member of the family behind the bar. So what is happening to the child out there? You have to counsel the mother out here. Tell her, look, you are a woman. If there is a violation is happening to a child who is a girl child. It can happen to a boy child also. It's not only a girl child. It can happen to others also. So the counseling has to be done, all-round counseling. Doctors to build strong opinion on access to safe abortions. Okay. Support persons can request product or services already have covered. A strong trauma management structure to be drawn up. I think in one-stop centers you have it, where the police, CWC, DCPU, medical professional, court, counselors, CCI, caregivers, NGOs all converse and coordinate with each other. And I think you should have once a month meeting where all these things that I'm talking about, maybe you have a format where it's not easy to remember every time you have a meeting that these are the points that you should be touch base upon, touching them. and you're having a discussion as to what's happening. Are we on the right track? Are we deviating? Where are the gaps? So maybe you form a format, or maybe you have it already. I don't know. I'll ask you after the session is over. So now we get into the next bit. Interaction of the prosecutrix with the presiding officer, public prosecutor, defense counsel related to her deposition. What happens? Defense questions are inevitably hostile, often sexually explicit, intent to insinuate lack of resistance. Yes, it happens. And questions in cross-examination that are rooted to the prosecutrix through the presiding officer to prevent harassment and intimidation by the defense counsel is not established practice. It should be going through the presiding officer. In writing, it goes. He or she, the presiding officer, would put the questions. The video audio way it is done, right? In one-way video audio, where the accused from the defense counsel gets to hear, doesn't see. This one gets to see, not the other way around. Most of the prosecutors do not know about their right to be accompanied by a support person or companion during deposition. No pre-trial orientation. This is very, very important. Pre-trial orientation of the survivor, leading to undermining of access to justice, as well as informed participation. The PP only meets the prosecutors in court and most often fails to orient the child about the process in the pre-trial stage. Uninformed participation. What will happen? It will lead to further exploitation. Lack of informed consent for medical opinion, most importantly not applying for compensation available to victims under law. These are all the drawbacks that I have put out here. Okay, the IO, the PP, they play a distinct role at different stage, but victim orientation is usually not part of anybody's brief. This is extremely important, this part that I'm talking about. This leads to family vulnerable to all influences and coercion, often making compromises, and it seems to be a more viable choice. That means they go hostile. They go hostile. They have no other choice. They don't have any support from the system. What will they do? So the SPP may meet the prosecutors if prior to the date of hearing or even just prior to meeting in the courtroom. He or she can do that to orient the prosecutors to the requirement of trial and to understand the version beyond the written word of the record. Support person can be there to help. If the support person by chance is not there, the PLV can be there to help. Support person is supposed to be given by DLSA also in POCSO. They can help explaining to the prosecutors in advance of the court hearing that he or she is entitled to a support person or a compensation, like I was talking about. Explaining to the prosecutor that she is entitled to apply for compensation, that is interim compensation. Then we have special relief in POCSO 2022 rules given by the CWC. Money can be given by CWC, that is also there. Public prosecutor would also help integrating and communicating the questions to the prosecutor. Okay. Seeking the court's intervention in restraining the defense when they ask very uncomfortable question, traumatizing question. Now, in this Supreme Court order, in Nipun Saxena versus Union of Ministry 2018 order, you know what they have said? That the second paragraph, the victim is required to repeat again and again the details of the rape incident, not so much so as to bring out the facts on record or to test her credibility, but to test her story for inconsistency with a view to attempt to twist the interpretation of events given by her so as to make them appear inconsistent with her allegation. That is why the court therefore should not sit as a silent spectator. You cannot do that. While the survivor of the crime, the victim of the crime, is being cross-examined by the defense, it must effectively control the recording evidence in the court. While every latitude should be given to the accused to test the veracity of the prosecutors as per law and credibility of a version through cross-examination, the court must also ensure the cross-examination is not made a means of harassment or causing humiliation to the victim of crime. Totally, that is what a victim of rape or sexual assault must be remembered has already undergone a traumatic experience, and if he or she is made to repeat again and again in unfamiliar surroundings what he or she was subjected to, that child may be too ashamed and even nervous or confused to speak, and her silence or a confused sentence may be wrongly interpreted as discrepancies and contradictions in the evidence. That is what the court of law has said. If you can, please go through it. And that is the reason they play a major role out here. So, communication with the prosecutors, what they can do, they can explain before the trial begins, they can give them, break down the questions, they can intervene when the defense counsel is intentionally harassing the child, so offering them water and chair, so they can reduce the re-traumatization of the child. Okay? Very sensitive. All of us, this is for all of us. It should be a very sensitive approach. Right? Now I'm getting into CCL. What is this? Can you just quickly tell me what this is? What it resembles? Quickly, any of you? Quickly, can you tell me what it is? Yeah? What does it look like? Yes? Yeah. Switch on your mic and tell me. What does this look like? Is it a bucket?
A car.
A card, yes. What sort of card is this?
It's a Ferrari.
Ferrari, yes. Meant for what? It's a
Racing.
Yeah, correct. It's a racing car, right? Now hold on to this, what I said just now, what you said just now. It is a racing car waiting for get, set and go, right? So what is a CACL? I think your ma'am who has taken the doctor ma'am who took your class, I think has already told you about adolescent's brain. It is a Ferrari car, it's a racing car. Because what happens, it is a car without a brake. It doesn't have a brake. It says it just go. So this prefrontal cortex of our brain, that is this part. I think she's spoken about it, right? The prefrontal cortex of our brain, it is a crucial component for impulsive behavior and critical thinking. Two things. Should I do it or shouldn't I do it? No, I should do it. It is unlawful. It is going to hurt somebody. A child or adolescent doesn't think about it. I want to do it. Oh, great. I'm feeling so good about it. Let's do it. Let's do it. Doesn't know what is going to happen afterwards. Not bothered about it also. Critically, they don't think about it. Because this portion, it matures always later. Later on, it matures. 18-year-old is nothing. 23, 24, 26 also. It doesn't mature. So it is known as the control panel of the brain, of our personality, of our brain, and our abilities to communicate. Even by age of 18, our brains aren't developed. It is an unfinished product. Pruning takes place. You know, pruning of a tree, pruning of your hair, right? We prune it. So the brain continues to prune, develop well past the legal definition of adulthood, undergoes radical changes throughout the teenage years. This is the time of emotional and behavioral upheaval and long-lasting stress. Something has happened when I was a child that will continue because it can happen at the prenatal period, it will go through childhood and it continues to adolescence, and that will make up our mental health. Yeah, good or bad, whatever bad, I never say a child is bad. I would say there is scope for improvement. Why the child has done this, it is important to get back to see. Okay, that is why mental health is very important. I find physical, it is more important than physical health. Physically, a hand is broken, you can mend it. You can remove one organ or you can stitch up a cut area. You can do that. But mental health is important because that takes years and very specialized person, trained people should be handling mental health. Long lasting stress affects long term changes on physical brain development which continue beyond the duration of the stress. The trouble happens in three areas. They conflict with parents and guardians. I know, I am a mother. My children, one has gone through already, has become an adult, the other is going to adolescence. I know what are the trouble areas they go through and what they could make us go through. Okay. Mood disruption, yes again, and risk-taking behavior. Yes again, we know. We who are adults, if we are dealing with adolescents, we know what we go through and what they go through. They are all unfinished articles. So understanding them, critical thinking, impulsive regulation, regulated by the prefrontal cortex. I have already gone through, and which part of the brain it can affect the development. The environmental stress can affect, psychosocial stress can affect, and sorry, again I have repeated, environmental toxins can affect. These are the three things, and I'm sure she has explained to you environmental stress, psychosocial stress, and environmental toxin. What are these three things? Okay. Now, the profile of the CACL, if you see, the child alleged to be in conflict with law, a child found to be in conflict with law, we find that the socio-economic background and the mental development, these two things, they are majorly responsible for deviant behavior, for non-conforming behavior, for unlawful behavior, and then they entering into the juvenile justice system, and sometimes, unfortunately, into the judicial process they enter, right? So characteristics of the adolescence period I have already spoken about. Spurt of cognitive, emotional, physical, and sexual development. Spurt. It comes in spurt. It is not a slow development, Sometimes it's cognitive, sometimes emotionally they are very matured, physically, growth is happening to them, sexually they are developing, but they do not know how to deal with it. They have the urges, they want to experiment, but they do not know what to do about it. We hardly have any sexual education happening in our schools. Parents do not do it in the house. So what is happening to our children? In the societies where the families, the parents, they are hand to mouth situation. They are going out to work. Forget about all these things, development, emotional, physical, sexual development. They are not bothered. They are into providing food, 2 square meals per day, a shelter, clothing. They are into that. So for their children, who is giving them that support? As society, as state, are we giving our support? So the DCPU personnel out here, it is so important that you now the thing has this thing amendment has come in the 2022 rules. I am so happy. In these rules, it is mandatory for the CWCs, for the DCPUs, for the JJV, all of you to get into non-institutional care ICP, individual care plan for the non-institutional care children also. We are getting into the community also now. It is there very much now mandated in the act, in the rules. In the rules it is there now. So we cannot get out of it. The growth from adolescence to adult is a process of confusion and conformity. Should I do it? Shouldn't I do it? Right? Multiple vulnerabilities, or economically deprived if they're poverty, and in family they're deprived. Schooling is not correct for them. Peer pressure is there. Community level pressure is there. It will amplify the risk of child and adolescent behavior, adolescents deviant behavior. Okay, I put it in a cycle. For example, take it a child's family is extremely poor, very very poor. Now, do not get into BPL. We do not get into BPL index. That index has shifted. I hope you know. I was trying to read up on that also. When we talk about poverty, it is not BPL index only. There are a lot of indexes has been given. So if you can, please go through it, and then we can declare that this child is poor or economically deprived. Both parents needing to work, so they are out. Parental neglect. This leads to parental neglect, weak bonding, very little interaction between them, absence of adequate supervision, monitoring, guidance, unwillingness to involve with children, parental conflict, discipline, non-disciplining, deviant behavior, family disruption. So many we have got. Harsh punishment, drink and come back home, beat up the child, black and blue. They do this. This will lead to what? Easy detachment from the family, children drifting away, lured towards deviant similar children, peer groups, externalizing problems. That means they become violent, aggressive behavior. Harsh punishment will lead to deviant behavior, lured to bad habits, imitating elders, single parenting. That also will lead to complete freedom, and that again will lead to risk taking, unlawful behavior. You get into a system where they are detained or they are apprehended by the police, going to the SJPU, Special Juvenile Police System, going to the board, involvement into the system, then they get released. If they are released without any SIR, it's a social investigation report, no counseling taking place, no individual care plan, no rehabilitation, no follow-up, just the child is released, get back into this vicious cycle. Okay, so parenting and all of us handholding is very important source of social control. Over here, I have not put poverty because we get cases where they're stinking rich parents. Just the same thing, you could say. Both of them are working or they are preoccupied. Partying, father is a businessman, mother is partying. Or both of them are IT professionals just minting money. They don't have time for children. Then that leads to sometimes overprotection, child centeredness. Again, the same thing. It leads to sometimes denial. My child would never do such thing. I have put my child in such a good school. My child has, you know what, those iPhones. My child is, IT product, means a product of this age. My child can't do such a thing, but your child has done it and has come to the JJB. How is it that these things have happened? So again, easy detachment from the family. Sometimes you give them tacit support. Again, risk-taking behavior. Again, nothing happens. No input from our side, from our system. Again, the child gets back to the system. Again, it's a vicious cycle going on. So now the fear factor, like I have told you, uncared for, non-supervised, fear of will lead to fear of isolation, joining the peers with similar background. They want peer approval. They want approval for the deviant behavior. Yes, look, I have done this. I have, you have abused that girl. I have also abused this girl. Just see, you have done this showed dominance. I have also showed dominance. These sort of things happen. Now taking risk, they take risk, experimenting with exciting, dangerous activities without perceiving the consequences. Now adolescence urges, what happens? Sexual urges I'm talking about. Curious. They want to experiment. This is very normal. If it goes unsupervised, if it is uncontrolled, sexual urge, specific to their developmental phase, lack of sexual education will lead to exploitative and devastating result for both the child who does it and both the child who goes through. And where the adult means this child might become an adult, and after become an adult also might be doing it. By then POXO will apply. No more JJ Act will come into it. If a child becomes an adult and does it, then the POXO applies. And death penalty is the ultimate. So we have to stop them now. Community factor, weak neighborhood, communities are typified extreme poverty. So we have to do our need assessment and risk assessment. In Mission Vatsalya, if you go through, there is the portion of CPCs, Child Protection Committees. They have to do a risk assessment and need assessment. All of them. You will read about it. Over there, this thing comes in. Which is a weak neighborhood? Which is a community that can be typified? Extreme poverty community, high population, high incidence of crime and violence, availability of drugs. These will lead to these things. Okay? Now we talk about migration. During lockdown, what happened? Even during the COVID times, what happened? Migration, live on the margins of the society in the brick lanes, in the structures. This migration of this. The entire family comes from Bihar and all. What happens out there? They have those. They are usually farmers. Farmers means they work in somebody's landlord's land. So over there, if there is no farming happening, then they migrate with the family. They migrate. So they can be anywhere. It can be in a structure, in building structure. They're over there. They can be in brick lanes. They can be. I'm just getting this two in my head now. They can be anywhere. This sort of they can be in leather factory, in other factories. So they live on the margins of the society. They do not get the benefits usually. They do not have Aadhaar cards because now it is mandatory that all, even migrant workers' children should be having Aadhaar cards. They should be giving schooling. All these things have been are there now. So migrated with family or alone. Majority of them live on streets. They are street children. Generally less supervised or controlled, parents busy in making to ends meet risk of being associated with deviant elements, and they are out working themselves. Yet the laws are the harshest on those who are socially, politically, economically. Okay. Now we are getting into, quickly I'll go through the model rules. 2022. What is it talking about? The medical care. I'm getting into 22 because I know 2019 is your Sikkim model rule. So I have taken the liberty of putting 2022 because the additions I have put out here. In 2019, what you have, some has been added. CCIs, all CCIs should have been a medical officer and shall be made available, who should be made available on call whenever necessary for regular medical checkup, treatment of children. One, a nurse or paramedical medic should be available round the clock in the CCI. Every CCI may arrange, may or shall, sorry, it's not may, it's my mistake, it shall arrange for medical examination of each child admitted in an institution by medical officer within 24 hours of admission, and in specific cases for medical emergencies immediately. So a traumatized child, the physical and mental health both, at least the doctor will come and say that this child needs immediate counseling. Mentally traumatized, that can be written in the description. Provide or arrange for regular counseling of every child and ensure specific mental and health interventions. So in italics what I have given, that has been added now. Periodic medical health screening of each child to be conducted with the help of nearest government healthcare facility. That has been added now, this time in 2022. The separate rooms should be given for counseling sessions within the premises of the institution, and referral to specialized mental health centers where it is necessary. And lastly, they are saying refer such children who require specialized drug addiction and rehabilitation program. That's why I put it out here. To an appropriate center administered by qualified person running under any government scheme. I think this has been added now. Government scheme of ministry of or department, where these programs shall be adapted to the age, gender, and other specification of the child concerned. So linkages has to be done with other department. It is not only DWCT. It is with the health department also. This is very important. Okay. Now, Rule 35, mental health. I put it. Now, the environment in the institution shall be free from abuse, allowing children to cope with situation and regain confidence. One, all persons involved in taking care of children in an institution shall be provided necessary training or capacity building, so as to provide facilitate enabling environment. Now, what is enabling environment is very important to understand, and work in collaboration with the therapist as needed. Now we are getting into the definition. Milieu-based intervention and individual therapy are must for every child and shall be provided in all institutions. If possible, please note these three words: milieu-based intervention. This has to be there in all the CCIs. For explanation, for the purpose of sub-rule, milieu-based intervention is a process of recovery which starts through providing an enabling culture and environment in an institution so as to ensure that each child's abilities are discovered and they have choices and right to decision regarding their life, and so as to they can develop and identify beyond their negative experiences. So believe me, nobody wants to come and have fun in the CCI. It is not for fun. It is for a therapeutic treatment they are coming. It is they want to put behind their negative experiences. For some reason, a child is being sent to a CCI. Such intervention which has critical emotional impact on the child. So milieu-based intervention is extremely important. So whenever monitoring is done by the DCPU, now DM we will do the monitoring. The CWC is concerned will come to do the monitoring. So they will look into a milieu-based intervention is being done or not. The facilities available under the concerned mental health program at the state or district level under Ministry or Department of Health, like I was telling you. So shall be utilized for providing. So you should be knowing that this department, what are the facilities they are giving you for the mental health to the children, for mental health to the children. Are you aware of it? Is it put down somewhere in your records, in your this thing in the CCIs? Is the DCPU aware of it? Every institution shall have the services of trained counselors or collaboration with external agency. That is what I'm telling you. You're not doing it alone. It is with convergence, such as child guidance centers, psychology or psychiatric departments, or similar government or NGOs for specialized or regular individual therapy for this. So these things, please, if you do not have it, keep it ready. And it should be evolving, whatever list you have, because people do get transferred. Somebody else comes in. So immediately the name gets changed, the number gets changed. Okay. The recommendations of mental health experts shall be maintained in every case file as required. No child shall be administered medication, I'm sure you know it and you do it, for mental health problems without a psychological evaluation and diagnosis by trained mental health professionals. Medicine should be administered to the children only through trained medical staff and not by any other staff of the home. 39, what does it say? This is another important portion. Please note, the management committee shall meet at least once every month to consider and review the mental health intervention as part of it. It's number 4. 4. I have put it down out here. There are other things also for my this thing. I have put it out here. Okay. Now, this talks about immediate assessment, immediate need assessment of a child. Number 10. I'm continuing with that. Rule 54. Now I've got into JJ rule. JJ rule is talking exactly about like POXO. So quickly I will go through it. What do you do when a child comes to you on under rule 54? Any offense that happens, immediately need assessment review of the child. Who does? The police officer does. Where a child has been subjected to sexual abuse, the child will be referred to a district hospital. You have your one-stop centers, message centers, they are referred there. Special children's room may be designated in every court complex. They are talking about this. Okay, it's exactly the same. Now, the statement of the interview of the victim or the witness child shall be conducted while ensuring these conditions. See, this is exactly matching POXO. You go through it, it's exactly matching POXO. You're still talking about the same things at the residence or where the child is comfortable, verbatim, the simple language the child speaks, audio video measures, accompanied by the child should be accompanied by parent or guardian. The PLB can this thing for pre-trial counseling. If the support person is not there, the legal services authority will give you PLB. PLB can do it. The child victim or witness does not belong to the district or the country or the state. It can be done through video conferencing. Don't pull the child to court again to give witness deposition. It can be done through VC. So this is actually in making now. In our state also, we are now gunning for this. Child goes back to Bangladesh or Nepal or Bhutan, because our bordering states, we are trying for VCs. In other districts also, we are trying for VCs. In other states also, we are trying for VCs. So the child is not pulled. Okay. Now, in this, where video conferencing is not possible, all necessary accommodation, travel expenses for the child and a guardian accompany. This is important. I dispute doing it or not, I don't know. They should be providing this to the child. Their support person is there, and I'm sure this is involved in these cases, so you should be giving it to them. When the child goes to depose, separate rooms for vulnerable witnesses. 18, during a trial involving a child-friendly atmosphere. Again, the same thing. See, person of child's choice, a fit person, representative of fit institution, identified as psychologist appointed by the committee. So, whomever the child is comfortable with, the child should accompany the child. Psychological counseling may also be provided to the child wherever necessary. It is given in 2022 Rule 54. Okay. So now, in a situation where the parents or guardian may have been involved in the commission of the crime, or where the child is living in a place where the child is at risk of further trauma, the same is brought to the notice of the court, or the court on its own motion shall direct the child to be taken out of the custody of the care or out of such situation. The child should be immediately produced before the committee. This is also there. If the child, look into the safety and security of the child, best interest of the child, and always work in a child-friendly manner. Process has to be child-friendly. These are the three things: safety and security of the child, we work in the best interest of the child, and the process has to be child-friendly when the child is in the system. Okay. Now we are getting into. Okay, I think. Okay, this is one thing that I wanted to show. This portion. Images or statement admissible in the interview of the child, not to be detrimental to the mental and physical well-being. I spoke about images can be shown, photographs can be shown, but it should not be detrimental. The language should not be detrimental. Length and questions admissible at the time of interview should not be taxing. Alternative method should be, adapted for interaction and evidence collection in case of young children or otherwise incapacitated child. Okay. Now, this is something, section 53, rehabilitation and reintegration services and institutions. I think you know about it. I will just quickly just put it out here. I gave it for this. Occupational therapy and life skill education should be given in the CCIs. Mental health interventions including counseling that is specific to the need of the child. I am again repeating, counseling that is specific to the need of the child. It should not be randomly counselor is going and counseling children. That should not happen. Okay? You should know, it should be a trained counselor who knows exactly or referred by a psychiatrist or a psychologist as to these are the points of intervention, right? Legal aid should be given, referral services for education, vocational training, de-addiction treatment where diseases, case management, including preparation, follow-up of ICP, birth registration, and assistance should be given, right? Now, these are the things, don't you think, that a rehabilitation of a child who comes to a CCI and now rehabilitation for a child who stays in the community also. So, social background report is always given by the police on first production for child alleged to be in conflict with law. 1. Report at the time of production goes to CWC, child in need of care of production, form 17. Counseling report, social investigation report. That will lead to making of individual care plan. Now, what I said above was the diagnosis. Now we come into the treatment, individual care plan, referral services, child sent to a fit person or a fit facility, foster care options are there, group foster care, family foster care, aftercare options are there, child given for adoptions, child given to sponsorship, schemes, central government schemes, state government schemes and services. Money from the Juvenile Justice Fund can be given. The rehabilitative stay of the child in the CCI or outside in the community. Then we issue the rehabilitation card as to see the child says, yes, these are the rehabilitative measures taken by the institutions for me. That is rehabilitation card in form 14. Okay, this is the treatment and then a follow-up is done. So without a follow-up, this is completely of no use, believe me. Okay. So we stress on family-based care. We give priority. We give all this backup. Whatever is in red is non-institutional care, except rehabilitative stay in CCI. And in CCI also, we are giving our individual care plan and the backup. Okay. SIR, we go through the newer version. In the rules, this has been added. Information about whether the child is orphaned, abandoned, surrendered, and other, where the child was previously staying, where the child needs repatriation. This has been added newly. The child who may belong to our children in street situation, trafficked, involved in drug peddling, labor, and the child, if the child is a victim of any kind of abuse, including sexual abuse or a victim of any of this has been added. These things has been added. Now in SIR, I'm not getting into it because this is already there. This is not new. In 2016, this is there. So these are things are very important. The SIR, and then the ICP. It has to be an evolving plan, inclusive, participatory. It is not a static document. Okay. And this is the newer version. There's no time. I'll just quickly put it out here. I put it in bold. Information of a child who have been in a street situation, traffic involved, drug peddling, information child. This is there in the ICP. It has been added. Information of a child in adoption. These things all are newly added. This entire thing is newly added in ICP. It is like a tome. It's a big booklet now the ICP has become. Okay. Rule 7 talks about rehabilitation card. Now the mental health support counseling. I don't want to talk too much about it because I'm not a counselor. So what I learned about what is counseling, it is a talking therapy. where a person talk about their problems and feelings in a confidential and dependable environment. And the person who is listening is empathetic. Okay, it is more planned, structured dialogue between a counselor and the client, and a trained professional does this. Counseling consists of four stages. They identify the need for counseling, prepare for counseling, conduct counseling, and then you do the follow-up. And the mental health counseling is a very important part of counseling, rehabilitative counseling. Although the term counseling and therapy are often used interchangeably, there is a difference between psychotherapy and psychological counseling. Counseling is also more short-term than therapy. Therapy is something long, but counseling also, if it is a counseling therapy, it will be long. It will go on for months together. Psychotherapy is more long-term counseling and focuses on a broad range of issues. If I am going wrong, please correct me, because I am not too conversant about it. What I read about it, what I have heard, learned, I have given out here. Psychosocial care and support. Psychosocial factors are influences that affect a person psychologically or socially. This support is given to help meet the mental, emotional, social, spiritual needs of a patient. Psychosocial support is an emergency response. It helps the individuals and communities to heal the psychological wounds. The community also heals and rebuilds social structures after an emergency or critical event happens. It helps change people into active survivors, not passive victims. Okay, so psychotherapies are these sort of therapies, and community-based treatment, interpersonal therapy also takes place. Okay, these are all the different broad ranges of types of intervention. Now, trauma management therapy. I'm sure she's spoken about it. I'm not getting into it in detail. This is a very important part. Post-traumatic stress disorder. This is something all of us should know about. What is post-traumatic stress disorder and what we should be doing to take care of it. Okay, so the idea is to change the thought patterns. The last paragraph I'm going through, it is falls into the umbrella of cognitive behavioral therapy, and that disturbs our life. This might happen through talking about your trauma, or concentrating or where your fears come from, or through therapies. Now, I have just touched upon this play therapy and art therapy because it was there before. So I just read up and I've given something. What is play therapy? It's a therapy that usually primary for children, as they may not be able to process their own emotions or articulate problems to parents or adults. They are not being able to frame sentences to explain the way I'm explaining to you. I do not know how conversant I am about it. Hopefully, I am conversant. I am being able to put through to make you understand what I want you to understand. Okay, so play therapy might look like ordinary therapy playtime, but they are much more than that. A trained play therapist can use the therapy to observe and gain insights into a child's problems. The therapist can help the child explore emotions and deal with unsolved trauma. Through play, children can learn new coping mechanisms and how to redirect inappropriate behaviors. So, for CACL also, we can take the help of play therapy. Inappropriate behavior also we can redirect. It is practiced by mental health professionals like psychologists, psychiatrists, behavioral occupational therapists, physical therapists, and social workers. It is important for children in therapy to have flexibility with their language and choice to verbalize their feelings using words or toys. You give them a long rope. Let them use the words they want to use. Let them pick up the toys they want to. And I would not know the meaning of a particular toy. If a child picks up a particular toy or a particular thing, a particular color, the therapist should know the meaning of that. Okay, so this offers us a chance to talk with your child about what the picture represents and how it might relate to what happened to them. It is natural for the child to play with toys, but the things they are attracted to and how they use them can be strong indicators of how they feel. In essence, play is their most prominent language. What are the benefits? Through play therapy, your children can express themselves in ways they might not be able to if in words alone. One of the biggest benefits of play therapy, it gives a child the opportunity to experience happiness and healing, both. Simply by using their imagination or coloring a picture, they can feel some reassurance in knowing they are safe and able to interact freely with the toys of their choosing. What are this from here I've taken? There's nothing is my own. All I've read up and I've put out here. Play therapy sessions are typically held once a week. 10 to 20 sessions they are saying is ideal. Though it depends on how they're handling things, it might take longer also. The children who have a hard time expressing their emotions to heal from what they have been through. So it differs. Not only does play therapy help to improve the connections between you and your adult, to help them manage their own feelings and thoughts. Okay. If your child has been through a traumatic event and seems to be struggling, don't wait to get help. Play therapy could help. Perfect solution. This has been told by from here I've taken. Okay. Now next. Play therapy is to children what verbal communication is to adults. Right. Now this I like this. You know what Gittelson has told about that the child revealed far more of himself when talking about things he liked to do, his favorite toys, his pets, his friends, etc., than when he was face to face with a psychiatrist who questioned him first about his troubles. So important this part is. A psychiatrist should be going through a play therapy. That's what I feel. Just as there are many different ways that children play, there are different types of play therapy. For example, I've taken by Helen and Koskowitz, non-directive play therapy, puppets, dollhouse, other toys for the purpose of pretend play, interpret play for emotional content, directive play therapy, interpret drawings for emotional content, drawings, paintings for the purpose of emotional expression. So art therapy is also a part of play therapy. That's what I saw. This has been told by this. Now we are getting into art therapy. I have 5 more minutes to go. Quickly, I'll go through this. I have taken from here. Art therapy helps children cope with trauma. So this I have taken. Art opens up a non-verbal form of communication for children having a tough time expressing their thoughts and feelings, designed to help heal psychological wounds and often it can point towards a source of trauma. This is so important. The colors that they choose, the drawings that they drew. This drawing that I have given out here, this one, is drawn by a 10-year-old girl who lost her sister in cancer. Immediately after that, she's drawn this part. Just look at it. This is her sister, I think. Lost. This is the child. This is the younger brother. This is the father. This is the mother. And out here, I think this is what I feel. My interpretation. I might be wrong. That she has gone to heaven. The wings are there. Angel. She's become an angel. She's no more. So through the program, kids learn various coping strategies, including anger management and valuable interpersonal skills. This is important for our CACL also. Child who alleged to be in conflict with law. He helps them discuss and deal with upsetting life events. Art therapy teaches kids how to express and understand emotions through art. It can be especially beneficial for children who are unable to verbalize their feelings. Repeatedly, they are telling the same thing. Studies show that childhood trauma can impact brain development and mental health and can lead to increased level of suicide, alcoholism, and drug addiction. Other way around, it can go. Early intervention is key to how through Hindu special educators suggest her writing that working with traumatic experiences reduce the anxiety and fear among students. How method was going to how they told to and is very subjective. According to the art therapist, the manner in which the child engages with the medium of art changes as they grow up. So today a 5-year-old would be drawing a house, tree, and person. Same person when becomes 10 would draw something else maybe. Okay. So I've come on to the second last one. From this site I took this. Violence and art therapy program heals hearts and empowers young survivors. Violence and assault to children results in attachment, mood, and behavioral disorders. So art therapy is a form of intervention thought to be effective in the treatment of trauma disorder and is being increasingly used to address child abuse and is often a primary form of therapy with children who are recovering from physical or sexual assault, verbal abuse, and neglect. It is happening and very, very important now happening thing, I would say. So over here, Tamarella Hurl, she is working in Kansas, out there. She says, I think she's an art healer. I think the greatest value of art therapy with children who have been abused, neglected, is that to provide an opportunity to give voice to their pain. The images they create provide tangible proof of progress that they have made, and this can be especially helpful on days when our children feel discouraged about their progress. Visual art seems to come readily to many children and adults who have been abused or neglected. They have told this. They have a heart-to-heart child advocacy center with children. Art offers a child something to do besides talking. What do we do? Call them to the police station, give statement. 164, give statement. Go to medical examination, give a statement out there, history taking. Go to the witness deposition, give statement. Go to a counselor, talk about what happened. No, they do not want to talk. All of them don't want to talk. Some of them might want to talk, some of them they do not want to talk. What about them? The art offers a child to do something, a child something to do. He starts talking. Children may resist a verbal approach to therapy. One of the reasons for this is that small children simply may not have the language skills to tell what happened to them. Older children may distrust verbal communication because their abuser probably lied to them and threatened them. To add to this insult, other adults will not believe them. That is why art therapy, play therapy is very important. Now, I will not get into this. This is again the same thing, in a different way. People have spoken about how clients learn to cope with their memories. Non-direct methods may enable client to trust the possibility of recovery. All these things. It's like a literature review I went through. Now, this I got from a group. I just loved it, so I just put it out here. Empathy lens. See, this is my lens, and then there's a split gone out here. To understand my perspective, ask me to live my experience, listen to me. So let us start with the left part. You make assumptions about my lens. Exactly. Connect to my feelings, not your experience of my feelings. Had you gone through this, what you would have felt? Sorry, no. Connect to my feelings. We usually say, put yourself in their place. No. Listen to the child, what the child went through. You might be feeling different it had you gone through that experience. My lenses doesn't match your lens. How would you feel in my situation is not how I feel. Imagination is judgment, not my reality. Our lenses now it says, then the person thinks. Our lenses evolves. So a child talks about a child is 5 year old will speak something. Child becomes 5.5 might speak something else. They are evolving. Their thought process is evolving. We see and experience world through our own lens. Yes, that is true. We should not give them space to share their lenses. Yes, believe them as they see it, not as you imagine it. Absolutely true. Feel it with them, not for them. Feel it with them, not for them. Our lens has been shaped by our own experiences, culture, beliefs, values, bias, etc. Extremely true. Don't get biased. Try to clean your brain completely and sit down. Unlearn and then sit down with the child. This is my last slide. I can choose not to answer. Do not push for an answer. My children are telling this. Interview me, film me, take me. Do not forget to ask my parents, caregivers, informed permission. It is my right. If I am a minor, do not talk down to me. Do not forget to inform me when I have been co-recorded and what is on and off record. I have every right to know. Be my voice. Feel my pain. Help me build a safer world. Thank you. I hope
Yes, ma'am. Thank you so much, ma'am. Having
I
come to
don't.
the end of today's session, yes, ma'am.
Yeah, I hope it has been helpful because I was a bit skeptical because of the topic that was given. So I just hope and pray that it was helpful. Thank you.
Yes, ma'am. Thank you so much, ma'am. Having come to the end of today's session, I now request Learned Director, Sikkim Judicial Academy, to kindly offer the vote of thanks.
Thank you, madam. For the logical second session of today's program, it is my honor and privilege to conclude this same by offering vote of thanks to all, especially the learned resource person, who, keeping aside all personal comfort and convenience, has been kind enough to accept our invitation and deliberate on important topics of today's program to our learned participants, for which it is my unique privilege to extend sincere gratitude to you, madam, for sharing your precious time, valuable knowledge, and eminent views with our participants on the topic of today's program, which are really remarkable and this informative to all learning participants. Once again, I would like to offer my sincere thanks to you. I equally would like to offer my sincere thanks to all learning participants who, keeping aside of all their previous commitments, like the personal comfort, the number of assignment pending, without hesitation and reservation, participated in this program through virtual mode and made this program a great success with their active and conscious participation. Once again, offer my sincere thanks to all. And I would like to offer my sincere thanks to Geeta, my staff, who has they rendered me so much of now service to make this program a great success. With the consent, with these words of learned resource person, I am to conclude the second session of today's program. Thank you, madam. Thank you all. Thank you. Thank you so much.
Thank you so much. Thank you. Good day to all.
Thank you.
Thank you.